sounds crazy. They can say I've lost my mind. I don't care, so call me crazy. We can live in a world that we design. 'Cause every night I lie in bed, the brightest colors fill my head. A million dreams are keeping me awake. I think of what the world can be, a vision of the one I see. A million dreams is all it's gonna take. A million dreams for the world we're gonna make.
There's a house we can build. Every room inside is filled with things from far away. The special things I compile, each one there to make you smile on a rainy day.
They can say it all sounds crazy. They can say we've lost our minds. I don't care if they call us crazy. Run away to a world that we design. 'Cause every night I lie in bed, the brightest colors fill my head. A million dreams are keeping me awake. I think of what the world could be, a vision of the one I see. A million dreams is all it's gonna take. A million dreams for the world we're gonna make.
However big, however small, let me be part of it all. Share your dreams with me. You may be right, you may be wrong, but say that you'll bring me along to the world you see, to the world I
Close my eyes to see. I close my eyes to see. Every night I lie in bed, the brightest colors fill my head.
A million dreams are keeping me away.
A million dreams, a million dreams. I think of what the world could be, a vision of the one I see. A million dreams is all it's gonna take. A million dreams for the world we're gonna make.
Conquer the world. Tibay ng loob, everyone.
For the world we're gonna make.
Hello, good evening everyone. Good evening sa mga BBs ko dito sa sa Zoom at sa mga students na nasa portal. Magandang gabi sa inyong lahat and welcome to our panel discussion and quizmaster for tonight. So before we officially start our program, let us put ourselves in the presence of the Lord. In the name of Father, Son, Holy Spirit, Amen. Lord, true source of light and wisdom, give me a keen sense of understanding, a retentive memory, and a capacity to grasp things correctly. Grant me the grace to be accurate in my expositions and the skill to express myself with thoroughness. Be with me at the start of my work, guide its progress, and bring it to completion. Grant this through Christ our Lord. Amen. Father, Son, Holy Spirit. Alright, mga BBs, okay. Happy February pala, kaya ako naka-red para sa inyong lahat. Okay, ano yan? we will start early tonight, but ang tawag dyan, I have an announcement regarding the schedule before we start, if it's okay. So ang schedule natin for tonight, as you can see here, 6 to 7:30 will be our panel discussion. And then may emergency lang daw si Dr. Chu, our quizmaster for I am. So we will have a 30-minute break. So you can grab your dinner or freshen up. We will start at 8 o'clock. I will keep the Zoom open. All right, mga bees? Okay, I hope that's clear. Okay, so for our panel discussion tonight on how to maintain motivation and how to study with 25 days left before the PLE. All right, BBs, less than a month before your board exam. I know the pressure is building up. That's why we want to help you maximize your time with us here in Top Notch. Okay, so kung may mga questions kayo, B, in our panel discussion, please type it in the Zoom box. Okay? And our moderator for tonight, of course, is Doc Rolly. Good evening, Doc Rolly.
Good evening, everyone. Good evening, DK.
And then I will introduce our esteemed panelists for tonight. Our first panelist is Dr. Jonathan P. Chan. He's a graduate of UP College of Medicine, a cum laude, and took the board exam last October 2022 and has been teaching UPCAT and NMAT takers for more than 5 years. Our second panelist is Dr. Carl Philip Avilo, a graduate of West Visayas State University, took the board exam last September 27 and placed top 3 and finished his internal medicine residency at Philippine General Hospital. So the virtual floor is yours, Doc. Good evening.
Good evening. Thank you so much, DK. Okay, good evening, Jonathan. Good evening, Carl.
Good evening, everyone.
Okay, so basically, this is parang a reinforcement lecture of the panel discussion that we had at the start of the program. Okay, so for today, we're going to discuss 25 days to go. Ano ba dapat yung tactics? Paano ba mag-maintain ng discipline, concentration, motivation? Okay? Let's start. Okay? Jonathan, Carl, do you have presentations ba or diretso time questions? May presentation kayo?
Ako, Doc, diretso sa sa question and sa advice.
Yeah, I think we can go direction na po sa advice.
Okay.
Since discussing
So, context. So far, based on our schedule, the students are done with supposed to be done with the main lectures and the main handouts. All the 12 main lectures, and the 12 main handouts have already been given. They're in the middle of what we call the mastery period. During this mastery period, we have quizzes, okay, mga quiz master sessions. This is the ideal time for them to do a second reading. Either they read the handout for the second time or do flashcards, practice test din, okay? In preparation for PEARLS, which is the final phase of the preparation of the students, the pearls and the buzzword sessions. So right now, okay, some issues of the students, syempre nandyan yung mga backlogs, nandyan yung paano ba mag-maintain ng disiplina o magkaroon ng disiplina. Then we have yung mga issues of self-esteem for those who have taken the med boards before, or we have issues of great test anxiety for those who are taking it for the first time. But I've finished internship January 31, which gives them just 4 weeks to study for the med boards. Yun yung isa sa mga nangyari for this March batch eh. Dahil nagkaroon tayo ng October batch, pinaka-ideal is 6 months yung susunod na med boards, which is supposed to be April. So everyone was surprised that the med boards for March wasn't moved. It's still retained at March, giving some students approximately 10% siguro ng population ng Top Notch. Okay, just 30 plus days to prepare for the med boards. So first, let's start with the questions. Anyone in the audience, whether you're watching through the portal or through Zoom, okay, either you type your questions regarding tactics, strategies in the chat box, or you can message your Mother Goose, and the Mother Goose will then forward them to us. So question number 1, Jonathan and Carl. How do you actually maintain discipline and concentration 25 days to go before the med boards? Discipline, concentration, we've always emphasized that. What will be your tips for the students at this stage? Jonathan, first. then Carlo.
Okay. All right. So good evening, everyone. I think yung maintaining discipline and concentration, no, since there's only 25 days to go till the PLE, it would really depend on your personal circumstances. Because right now, kasi I'm also a mentor for some of the PLE takers, and anyway, even if I gave general advice on how to maintain yun nga, discipline, studying every day, some of their contexts are ano siya eh, like yung iba merong family member na merong sakit, tapos they have to take care of their parents. So even if I say na try nila na have the help of their siblings, some of the situation is different for each one of us. So, well, one thing that we can do, aside from the general advice, is to get a mentor. I think na-mention naman ni Doc Ron, na-mention na to get a mentor. Kasi if you have specific problems for your situation, parang it's better to have a more personal advice for yung particular scenario mo. But in general, in maintaining yung discipline, it would still be to stick to a schedule, and a schedule that's realistic. Kasi some people, when they try to consult with me kung ano yung schedule na nagawa nila, parang minsan, ano siya, like ang bigat niya. It's better for them to be able to stick to a consistent schedule rather than parang overload nila yung isang araw and then eventually mag-burn out sila and then di sila makaaral. So, maintaining a good schedule that you can stick with depending on your personal needs is an important point to consider. Doc Carl?
Okay. Good evening, everyone. Kung sakali lang na nag-choppy ako, sabihan niyo lang ako kasi parang pumapangit yung net ko currently. Pero anyway, with 25 days left before the PLE, yun nga, madalas nakakaranas na kayo ng overwhelm and yun, marami kayong backlogs. I think one of the first steps na gagawin ko if I were in your position is take a step back muna and then kasi ito na yung time na kailangan mong i-reassess ulit yung kung nasaan ka currently sa preparation mo. What I mean by that is you have to assess kung saan yung weak areas mo and then magbigay ka ng more time for that. Malalaman mo yung weak areas mo. Well, yung weak areas is firstly is dun sa 12 subjects, alamin mo muna kung saan dun yung weak areas mo. Meaning, Doc Rodney, na po ba sila? Nag-finals na?
Midterms pa lang, katatapos lang.
Midterm. So, may scores na natin po ba, Doc?
Meron na.
Meron. So, parang ang gagawin ko noon, pupunta ako sa diagnostics ko na score and then sa yung breakdown per subject and then sa midterms ko na score and then alamin ko yung breakdown per subject and then alamin ko kung saan ako dun lowest na pag dinivide ko kasi kunwari ang items ninyo sa nung midterm ninyo I believe 240 questions yata yan, so parang 20 per so dun sa 20 kung ang score mo kunwari ay 10 over 20, so 50% ka lang dun sa PrevMed, for example. It means na mahina ka sa PrevMed. So pwede mong gawin yon na i-assess mo kung saan ka weakest dun. And then kunwari, 10 over 20 ka sa PrevMed, pero sa Biochem is 16 over 20 ka, which is, ilan yun? 80 yata yun, 80% ka, kunwari, no? So medyo i-bottom mo yung Biochem kasi naka 16 ka over 20 dun sa midterms mo currently, no? And then, yun nga, kung lowest mo si PrevMed, kaya yung una mong basahin dun sa gagawin mo schedule for the next 25 days. No? So, dun sa 25 days din na yun nga, maliban sa pag-prioritize ng weak areas mo, meaning weak subjects, alin dun sa loob ng subject na yun, yung high yield, kasi kunwari yung anatomy, Hindi naman kasi lahat ng anatomy ay itatanong. Tapos, lahat nung handout mo is hindi lahat yung itatanong. Merong high yield na anatomy. So, paano malaman ko na yung high yield? Ang isa sa ways na malaman mo yun is through doing practice tests. Kasi yung practice tests na meron kayo, I believe 2 na yata yung sets na meron kayo, is based siya sa feedback ng students na recently nag-take ng PLE. So for example, yung practice test na meron kayo is based sa kung ano yung sinabi ng students na lumabas noong October 2022 PLE and March 2022 PLE. And sa PLE kasi, merong evolving trends. So for example, yung sabing evolving trends, merong mga topics na paulit-ulit lumalabas. So for example, noong 2017 pa lang na nag-PLE ako, lagi nang lumalabas yung ureter. Noong 2016, kay na Dr. Harold Chu, lumalabas lagi yung ureter. Ano yung relationship niya simula sa ureteropelvic junction, paano yung sino yung above or below sa between the ureter and the gonadal vessels as they course down papunta sa bladder, and then sino yung nasa taas or nasa baba ng cervical ligament, di ba? And then nasaan yung 3 constrictions ng ureter. The point is, kasi lumalabas na siya for the past 2 practice tests, dapat i-master mo yung ureter na yun, yung course ng ureter. Master means kapag balibalik ta rin man yung tanong, dapat is memorize mo talaga siya. No? So that's one way na pwede niyong i-tackle yung weak areas niyo dun sa, for example, sa anatomy, is alamin niyo kung ano yung trends and masterin niyo yung trends na yun. Na malalaman niyo nga yung trends na yun is dun sa practice questions. Pero hindi yun solution to everything. Kasi ang caveat dun is paano kung hindi na lumabas yung ureter this time around. So yun yung delikado ron. So dito papasok yung topic ng paano nyo naman ngayon aaralin yung backlogs nyo sa handouts ng anatomy kung magfo-focus kayo sa practice questions ng anatomy. So merong middle ground na kailangan nyo hanapin, and mahirap siya hanapin. Hindi siya, kumbaga, hindi natin siya kayang i-quantify, hindi siya ganun ka-tangible. Pero I think sikapin nyo na ang pwede nyo gawin is dun sa next 25 days is i-distribute nyo yung, for example, kung 25 days yun, lagyan na lang sa 24. So that would be 24 days divided by 12 subjects. So ilan yun? 2 days per subject, no? So meaning, dun sa 2 days per subject na yun, dun sa 2 days per subject, dun sa loob ng 2 days is magpa-practice test kayo and then maghahabol kayo ng handouts kung saan lang yung makaya nyo. Ang problema dun is, syempre, hindi nyo naman matapos yung handout sa loob ng 24 hours kasama yung practice test, no? Kasi, so ang pwede nyo gawin dun is talaga mag-move on kayo sa next subject pagkatapos ng 2 days. Kasi, ang mahirap naman doon is kung ma-stuck kayo doon, tapos 4 days yung in-spend nyo sa PrevMed, and then mawawala ng araw yung ibang subject. So, ibabalance nyo talaga yun, no? Kasi, pare-parehas kasi yung weight. Hindi siya tulad sa ibang exams. For example, sa PLE kasi, pare-parehas yung weight ng 12 subjects. For example, I'm not sure about the USMLE, pero kunwari sa Australian exams, yung IM is 55%. And then, kunwari, OB is like 5%. Ganun lang. So, mabigat yung IM sa ibang exams abroad. Sa PLE is pare-parehas. That is the reason kung bakit dun sa 25 days na meron kayo before the PLE is, I think, pero pwedeng, it depends on you pa rin. I think, kailangan yung bigyan ng equal importance, meaning equal allocation. Yung each subject, allocation in terms of days. No? And another thing is for the next 25 days, dahil nga sobrang kabado na kayo, hindi na kayo mahirapan kayong yung iba sa inyo ang gagawin, magsa-study hanggang 12, gigising ng 5 or 4. So that would be 4 hours. Undangered, well, marami ka mako-cover. I would give you that. Pero, ang problema, pag ginawa mo yun, dahil nga next 25 days na lang, problema, pag ginawa mo yun, may magkakaroon ka ng sleep debt. Debt, DEBT, utang sa tulog. Pag nag-pile up yung sleep debt kasi, on the third day, for example, or fourth day, talagang magka-crash ka. Wala kang maaral. Makakalimang basa ka ng sentence, hindi mo pa rin nagigets kung ano sinasabi. So, mangyayari yun. Ngayon ang problema, pag nag-crash ka dahil 4 days ka ng 4 hours ng tulog or 6 hours ng tulog, 4 days ka ng ganon. Pag nag-crash ka dun sa 5th day, kahit matulog ka ng 12 hours dun sa 5th day, hindi mo rin mababawi yun on the 6th day, 7th day. Siguro another 3 or 4 days mo yun bago mabawi. Yun yung mahirap dun. So, ang pwede nyo gawin is huwag kayo magkaroon ng sleep debt. Sikapin nyo pa rin na at least 7 hours kayo. May mga tao na naka-go by with 6 hours, sina Elon Musk, na 6 hours na daw tulog nila, or alam ko si Elon Musk lang. Pero most ng mga tao is nakaka-get by with 7 to 8 hours of sleep. And optimal ka for that day. So, kailangan mo talaga na matulog na at least ng 7 hours. Huwag ka na mag-9 or 8. 7 is, I think, okay na. No? Kasi you have to make the most out of each hour of the day for the next 25 days. The third thing, so number 1 na sabi ko is weak areas nga using practice tests. Pero yun nga, find the middle ground. Number 2 is sleep. And number 3 na sasabihin ko is mag-start na kayo mag-practice na i-simulate yung exam. Simulate meaning, ang isang subject is 100 questions. And sasagutan nyo yung 100 questions na yun for 2 hours. So ang pwede nyo gawin is talagang gagawa kayo ng, siguro kung mayroon pa kayo mga practice tests na hindi nasasagutan, mag-practice kayo na magsagot ng 100 questions na dapat masagutan nyo siya huwag nyo gawing 2 hours or 120 minutes. Gawin nyo lang na 90 minutes. So, in 1.5 hours, no? Kasi, wag nyo lang, basta wag nyo sagarin na 2 hours yung pagpapractice nyo. Ngayon, kunwari, wala na kayong 100 item question na natitira. Meron lang kayong pa 20 or 30. So, ang pwede nyo gawin na lang doon is, alamin nyo dun sa 100 questions for 2 hours, ilang minutes dapat kayo tumatagal sa isang question. So, kung gawin natin na 100 questions in 90 minutes, kasi sabi ko nga, wag nyo sagarin ng 120 minutes or 2 hours. So, 100 questions in 90 minutes is, ilan nga ba? 1.1 minute. So, that's 66 seconds. So, at most, maximum, at most, 66 seconds ka lang dapat tumagal sa isang sagot, sa isang question plus answer. Okay? So, pwede nyo i-carry yung 1.1 or 66 seconds. Pwede nyo i-carry yung rule na yun sa pagsasagot nyo ng 20-item question or 30-item question na dapat at most ay siguro 1 minute ka lang at most sa isang question kasama sagot, no? Ite-train nito yung subconscious nyo kasi pag ginawa nyo yun siguro once or twice, no? Or even thrice, matetrain nyo yung hello?
Okay, sorry. Continue, Carl. Meron pa?
Sorry. Pero yun, matetrain nyo yung subconscious nyo na kung hanggang gaano katagal kayo sa isang number.
Okay. Question. One thing I've noticed among our students, in terms of identifying yung weak areas nila, minsan pag second taker na or taken the med boards before, ang ginagawa nilang gimmick, titingnan nila kung ano yung grades nila, tapos titingnan nila kung ano yung pinakamababang grade. Tapos ngayon, ang mangyayari, they will have extraordinary attention and focus doon sa subjects na pinakamababa sila. The phenomenon I've noticed is that pag second take na nila ngayon, yung next take nila, ang nangyayari, nare-reverse. Yung dating matataas nila, bumababa. Ngayon, yung mabababa, tumataas. So sometimes, they still don't make it after doing that. What's your stand on this? Paano sa pag-identify, if you're a second taker, should you identify areas talaga based on the grades? Or at saka yung pag halimbawa, for the last med boards, ang pinakamahirap na subjects, pato, anatomy, and PrevMed. Pwede bang ang gawin na lang nila is relatively mag-chillax for those subjects and then ibuhos na nila yung total concentration nila sa legal med tsaka sa micro kasi yun yung pampataas. So what I'm asking from you is, paano ba dapat ang approach? Yung mga weak areas mo sa med boards, ibibase mo sa grades, yun ang tututukan mo? Or isasakripisyo mo na yung alam mong mahirap talaga based dun sa feedback? Okay? Carl first, then Jonathan.
Parang ngayon ko lang narinig yung phenomena na yun, Doc Broly. And very interesting to hear na may ganun, no? I think, and kasi kung nangyayari yun na kung saan ka weak no first take mo, on your second take is dun ka naman mataas. I think ang pwede mo kasi nga hindi mo mape-predict talaga na kung kumbaga 50-50 yung chance kasi na ma-predict mo nga kung ano yung lalabas eh. So I think kung ganun yung nangyayari, I think the best approach is magiging equal na talaga yung allocation mo sa all 12 subjects. No, kasi kung ang mangyayari ay kung mahina ka sa anatomy ng first take mo and kumbaga mababa yung grade mo sa anatomy sa PrevMed ng first take mo, instead of doon ka magbuhos ng maraming days, I think yon parang instead of magbuhos ka ng 4 days sa anatomy is gawin mo pa rin yung 2 na 2 days lang based sa pinag-usapan natin kanina na 2 days per subject. Now, instead of magbigay ka ng 3 days or 4 days, 2 days lang talaga, no? Kasi nga kailangan mong equal kasi ngayon nga equal yung dapat na allocation for each subject kasi nga pare-pare sila ng weight kung i-compute. And pero another caveat doon is dapat hindi kayo sobrang rigid naman na kung 2 days, no? Kasi kung kaya nyo naman, kunwari magaling kayo sa biochem dahil ang pre-med nyo, kunwari ay bio or MBB, kung magaling talaga sa biochem, edi gawin yung 1 day lang si biochem. So iba-iba pa rin, no? Pwede nyo sundin yung 2 days per subject na allocation. Pero kung magaling ka nga doon, kunwari sa lahat ng diagnostics and midterm mo, or even ang first take mo, or even ang med school mo, is madali sa yung biochem, gawin mong 1 day lang yon. That means meron kang isang araw na sobra. So doon mo yun ibibigay dun sa mga week mo na subject. No? Pero I think ayun, parang magiging equal allocation yon. Kung ganun ang nangyayari na nare-reverse no on the after the first take.
Okay. Yeah. So for this naman, I think tama rin yung sinabi ni Dr. Carl no na all of the 12 subjects have equal weights in a sense na in those 1,200 questions, there is 100 questions per subject. Now, the thing is, yun nga, yung in terms of allocating the number of days for each subject, yung mga magaling ka sa subject nito, for example, personally, biochem, di kasi yung undergrad ko kasi MBB ako. So like, honestly, yung biochem, that's the subject I spent the least time on. So, yun, okay yun if meron kang subjects na strength mo talaga. As for the 3 subjects mentioned, kasi kakatake ko lang nung board exam and nung October 2022 nga, yung anatomy, pathology, and PrevMed were difficult, but they're difficult for different reasons. For instance, yung PrevMed, I don't think na kahit aralin mo siya for 4 days, hindi mo mapapredict yung lalabas. Kasi the questions there are really not usual med questions. So pag gano'n na mahirap siya and hindi mo alam talaga kung anong lalabas, you should just allocate the same amount of time that you would do for regular subjects, even if it's difficult. Because hindi mo siya ma-predict eh. Pero may mga questions kasi doon, like questions on yung mga lumalabas about family medicine na almost every year naman lumalabas yun. Doon mapipredict mo talaga yun. So dapat alam mo siya. Like when it's asked to you, you should know the answer right away. Yun yung mga concepts in PrevMed that you could really master. Yung as for subjects like anatomy was hard, but I feel like it's doable. And tinanong ko yung mga kasi yung mga mentors ko, if they're here, I meant mentees ko rather. My mentees are here. Nakakausap ko sila, and when I ask them kung ano yung subject that they're having trouble on, a lot of them would say pharma and anatomy. And yung anatomy, I think, for the October 2022 boards was difficult but doable. In a sense na if you allot more time to it, not so much time na mag-obsess ka dun sa subject na yun, kaya siya eh. And I think since same yung Board of Medicine now sa March 2023 and October 2022, more or less the trend would be relatively the same. Although, ayun nga, na-mention nga kanina that it could change. Now, personalized pa rin siya na kung ano yung dapat na schedule that you should follow. But, again, since parang in general, we know that all 12 subjects have equal weight, more or less, same pa rin yung bibigay mo. Parang slightly itutweak mo lang siya in a sense na yung subjects na medyo confident ka, you spend a little less time, but of course, you'd still study it, but slightly little less time. But for the subjects na feeling mo kaya mo naman, like anatomy and pharmacology, I think yung iba, nahirapan sila doon. But I think if they just devote a little bit more time, mas doable siya and may yield yung effort mo doon sa grade na makukuha mo. So pwede mo siyang pagtuunan ng pansin if yun yung weak subject mo. Yeah, but in general, yun nga, the amount of time you should spend for all 12 subjects should be relatively the same. Slightly different lang per subject. That's my take on it po. Doc Bro.
I like that. Para kayong, for the students, you have to imagine parang ang board exam subjects, para kayong may 12 na anak. So hindi kayo pwedeng may massive favoritism in any of those 12. Kasi mag-aaway-aaway yan, di ba? Parang mga anak mo nga eh. So siguro konting equity, for those na a little bit more difficult, based on your midterms, you spend a little bit more attention. Pero hindi talaga sobrang far na parang inalay mo na ang ibang subjects. Okay? Be careful. Yung phenomenon na yon, yung sinabi ko sa inyo kanina na pag second take na confident ka na, uy, mataas ako dun sa subject na to. So nababawasan yung aral mo, uy, ito yung lowest ko. So ngayon napapakoncentrate ka. Nag-switch siya. It's very, very common for those na bumabagsak uli sa medboard. So be careful. Try to avoid that scenario. Okay? Next question. Starting with Jonathan. How do you combat burnout and test anxiety? I'm sure you yourselves have experienced burnout and test anxiety. It's a common phenomenon. Advice, tips for our students.
Personally, no. So I think one of the reasons why people have burnouts, especially yung days leading up to the board exam, no, napapansin ko with my friends nung tinake ko yung board exam last year, is that they have cognitive overload. Na parang nag-rant yung mga tao and even me myself sometimes. Parang ang dami kong kailangan aralin at this short amount of time that I'm not sure kung paano siya pagkakasyahin. Now, one thing that you can do is that if tinignan mo siya na parang ang daming kong kailangan aralin, you should break it down to shorter, actionable goals. Na parang, okay, so parang hundreds of pages yung handout na to. But for this hour, kailangan ko mabasa this set number of pages or this topic. Dapat mabasa ko yung topic na to. If you think about it that way, it's more manageable because hindi mo siya iniisip para haba naman ng anatomy, for example. But if you think about for this R or 2, ang aralin ko lang is the pelvis for now. Parang it helps you manage yung cognitive overload mo. So parang you break it down to smaller chunks.
And chunking talaga. Maganda yung ano na yan. Tinuturo din talaga yan. Okay, continue, Jonathan.
Yeah, tapos parang naka-overwhelm siya, 'di ba? Na ang daming nakalagay doon. Pero I think sa handouts, if I'm not mistaken, may highlighted pa rin yung mga important parts. May mga naka-bold pa rin doon sa handout. So yun, one thing kasi that people feel when they read the handouts that there's so much information, but you can actually prioritize important information, and you would realize that since I think meron silang mga quiz masters and meron silang yung mga refresher lectures. Meron pa rin yun, Bay? Meron pa rin, no? Yung mga refresher lectures.
Refresher lectures, no more. Quiz
No
masters.
more. Okay, quiz masters na lang talaga. Okay. So, yung quiz masters, no? Kasi if you would notice din kasi na yung important information na yon, parang umuulit yung mga concepts na high yield na na-mention din naman ni Doc Carl, na there are trends in the board exam that usually applies, no? So parang aside from reviewing yung practice test, pag na-review mo na siya, dun mo lapatan ng handout because you are able to identify yung mga points na wika and then yung mga points na important. And then once you read the handout again, parang, oh right, natanong na to sa akin doon sa practice test and nare-reinforce siya. So yung important, I think, for combating burnout is you chunk yung information na kailangan mong i-digest, and then you prioritize important information based on yung sa nakita mo sa practice test and kung ano yung mga past trends, no, na napapansin mo. No, Carl?
Yeah, I agree with Jonathan dun sa sinabi niya na one of the pwedeng causes ng burnout and overwhelm is iniisip mo yung dami ng aaralin mo in 25 days, tapos may buzzwords pa, may pearls pa, ang dami pang sessions, no? And then iniisip mo na hindi nagagalaw yung exam date. So yun yung nakakapagpa-anxious sa mostly, no, pag iniisip mo yung nasa future pa. So yun, I think it's very easy sabihin, pero you just have to focus kung ano yung ginagawa mo at the moment eh. Yun nga, one of those is yung sinasabi ni Jonathan na just focus on the first hour, kasi kung ikaw ay nagpo-Pomodoro, for the next 25 minutes, kailangan ko matapos ng 5 pages na to, kunwari, kasi kung 10 pages ka an hour, so 25 minutes ako mag-aaral ako basta matapos ng 5 pages na to. Yun lang isipin mo. Huwag mo isipin na yung aaralin mo bukas or sa isang araw or next week, no? Huwag mo na isipin yun, or yung hindi gumagalaw na exam date. Huwag mo isipin yun. Isipin mo lang kung anong tatapos mo on this hour, no? Kasi para yung kung sa basketball, wala naman, kasi kung ikaw ay nag-o-obsess dun sa scorer na nasa scoreboard, hindi siya gagalaw sa pag tumitig ka lang doon. Kumbaga, mananalo ka pag nag-focus ka on the next play. No, on the next play, on the next possession ng bola, doon ka mananalo. Pero kung nakatingin ka lang sa score, walang mangyayari, no? Nakakatakot na lamang yung kalaban ng 5 points and only 10 seconds na rin natitira. Makakatakot yun. Pero hindi ka makakalamang kung mag-focus ka dun sa scoreboard eh. So, huwag mo isipin huwag mo isipin yung is bukas or sa isang araw or sa yung exam day. Huwag mo isipin mo kung anong next mong gagawin. Ganun lang, no? And again, napakadali niya sabihin pero napakahirap gawin. Pero you just have to catch yourself pag you're deep in thought dun sa mga iniisip mo na pwedeng mangyari, magfe-fail ka or hindi mo matatapos yung dapat aralin. Huwag mo isipin yun. Basta mag-schedule ka, set mo yung schedule mo, mag-focus ka sa schedule mo, mag-focus ka sa inaaral mo on that hour, on that 25-minute session or on that 4-hour block kung ganun ka mag-aral, 4-hour blocks, no? So another, maliban sa sinabi ni Jonathan na yun, is another thing is minsan you just have to go back to your why you even, minsan yung medyo philosophical na yung reason. Minsan kasi hindi rin talaga nadadaan sa mga actionable and hindi man nadadaan sa pagpomodoro yung motivation. Minsan kailangan mo lang talaga isipin yung yung why mo. Bakit ka ba nagdoktor? Bakit mo gusto magkalisensya? Bakit gusto mo na ngayon pumasa? Sabi nga ni I just pulled this up kanina. Sabi ni this is from Friedrich Nietzsche. And sabi niya is, he who has a why to live for can bear with almost anyhow. No? So balikan mo yung why mo, no? Why you even started. And minsan yun lang talaga yung makakapagpaano sa'yo makakapag-push sa'yo na makakapag-push sa'yo na mag-aral pa kahit di mo na kaya.
Okay, I like that analogy ni Carl. Gagamitin ko yan. Imagine mo para kang natambakan sa basketball. Mga 30 points. 1 quarter left. Nasa katatapos lang ng third quarter. Pag-iisipin mo nga naman paulit-ulit na shit, tambak ako ng 30. Wala na to, talo na to. Talo ka na talaga. Pero kung iisipin mo, okay, next play lang, makascore tayo. Tapos ma-prevent natin sila makascore. O next play uli, makascore tayo, prevent natin sila makascore. Eventually, that's how comebacks are made. So in terms of backlogs, you really have to do chunking. Instead of thinking, I have so much to do, think of what do I have to do for the next few hours? What do I have to do for today? Doon muna tayo mag-concentrate. Small victories, very small victories, when they pile up, that's ultimately the one that will make you win. Okay? So, gagamitin natin yan. Yun yung perfect analogy yung ginawa ni Carl. Anyway, may mga questions already na binibigay sa akin. Meron ako actually mga listed questions already, but I'll be using yung mga binigay sa chat. Mas magaganda yung tanong nila. So I'll read them and then you can answer them, Jonathan or Carl. Okay? Question for Jonathan. Okay, having taken the med boards recently, ano bang advice nyo, Doc, pag may backlog na subject? For example, yung PrepMed, hindi ko po nababasa yung handout and yung video, hindi ko pa po napapanood. Since less than a month na lang po, should I go straight to the practice test and flashcards? Or basahin ko pa din yung main handout and watch the videos? I'm a retaker po, Doc. Thank you po, Doc. So, Jonathan? Bye? Naghang ka? Ako ba yung Si Jonathan yung naghang. Si Jonathan yung nawala.
Para naghang, Doc.
Okay. Any recommendations dito, Carl?
Si Doc.
Di pa nababasa yung PrepMed, one of the more difficult subjects. Should he skip it altogether, yung main handout, main video? Mag-practice test na lang, flashcards, or basahin pa rin yan?
I think dahil kasi iba yung situation mo compared sa mga first takers. Kung first taker ka tapos di mo pa nabasa yung handout, well, I think kailangan mo basahin yung handout. Pero kasi kung second take mo na, hindi na foreign sa'yo lahat ng nandun sa handout eh. I mean, kung meron man nadagdag or nabawas dun sa handout, konti lang kung meron man, no? So, I think dahil this will be your second take. Meron ka nang alam dun sa handout. So, I would advise But again, this is suggestion lang. I would advise na mag-practice test ka para alam mo kung ano yung lumalabas doon. Para kasi kung 25 days na nga lang, baka hindi mo rin matapos yung buong handout eh. Tapos kunwari nandun ka lang sa half. Nandun ka lang sa first half. Paano kung yung question sa exam ay nandun sa second half? So hindi mo na nga natakil yung second half. Tapos yung mga high yield pa na questions na nandun sa practice test, hindi mo pa na-master. So medyo talo ka doon, no? So yun, dahil nga hindi na foreign sa iyo yung handout ng PrevMed, I think pwede ka mag-practice test muna. Tingnan mo kung saan ka doon mahina, alin yung hindi mo pa na-master, alin yung laging lumalabas. No, sinabi ni Jonathan kanina na laging lumalabas, no? Na I would agree with him na sinabi niya na, for example, yung concepts ng family medicine ba yun, ay laging lumalabas, no? Another thing, kunwari sa PrevMed, is, for example, dapat master mo kung anong difference ng lead time bias, yung iba't ibang biases, no? Dapat master mo yon. Dapat master mo kung anong test ang gagawin mo, kung ito ba ay cohort or case control, cross-sectional. Dapat master mo yon, no? So makikita mo yon na yung mga questions na yun, kung tinatanong ba talaga sila doon sa practice test. And then pag nakita mo na doon sa practice test kung ano yung mga tinatanong, saka ka babalik doon sa handout and mamasterin mo yung handout. So, yun. I think pwede ka mag-practice test muna instead of i-try mong tapusin yung buong handout. Kasi I doubt na kaya mong tapusin yung handout in 2 days, in 1 to 2 days, no? Parang ang hirap nun. If anything, makakaabot ka ay half lang.
Okay. Context ha, yung handout ng math batch na to noong March 2023 was significantly changed from the October 2022 because of the new topics like management, economics na nangyari noong October 2022. Jonathan, naabutan mo pa kami kanina bago ka na-cut.
Sorry ba? Nag-brown out ka sa amin. Same question pa rin ba yung sinasagot?
Yes, sa PrevMed.
Sa
Hindi pa niya
PrevMed.
basado at all yung PrevMed handout and lecture video. So sabi pa niya, pwede bang i-alay na yung dalawang yon, palitan ng practice test and flashcards, or dapat pa ba niyang tirahin?
I guess it depende, no? Kung sabi niya na hindi pa na talaga nabasa at all. Depends sa context na kung first taker ba siya or
Retaker.
retaker. Okay, so yes, bye. So pag ganun, retaker, ang context niya ay retaker siya. That means na nabasa na niya yung mga important topics before. So I would agree with kay Doc Carlo na he or she should focus on yung topics na hindi siya familiar with, na mahina siya based dun sa practice test niya and based dun sa naalala niya dun sa previous take na. And aralin niya sa handout yung mga concepts na medyo bago, yung bagong gimmick ng Board of Medicine po ngayon. So like for example, yung management and yung mga health economics questions, especially yung mga questions regarding PhilHealth and yung mga models of insurances na I don't think naaral ko rin talaga nung when I was studying for the PLE last year. So yung mga bagong topics, yun, aralin niya. And yung mga concepts na hindi pa siya ganun ka solid with nung last take niya, dapat when he or she reviews, no, for the PLE, dapat ma-cover niya and ma-master niya talaga yun. So to summarize, no, practice test and then basahin pa rin niya yung handout but prioritize yung mga portions na bago sa kanya and mahina siya.
Okay. There are two related questions here that I'm personally going to answer because this one involve knowing yung actual system ng top-notch. I'll read them first aloud. One has to do with how to interpret yung midterms. The other is how to interpret yung results ng finals. Okay? Good evening, Doc. These midterms, I got green for the first time. I'm a retaker. I'm not sure, Doc, if I'm doing good now or I only answered better and mastered the art of questioning than top-notch. My question is, the top-notch grading a good indicator to take the med boards this March? I'm having doubts po kasi. The other student, hi Doc, tanong ko lang po kung anong iniisip ang advice ninyo at nag-iisip na akong hindi ituloy sa March ang board exams. Enough po ba ang final exams as final basis namin? Or kahit ano pong final grade po namin, tuloy pa rin namin, Doc? Okay? So listen. How to interpret your diagnostic midterm and finals? First, you never interpret those scores. Never interpret na, uy, 100 over 240 ako nung diagnostic, 80 over 240 lang ako nung midterms, ergo bumaba performance ko. Hindi siya apples to apples kasi iba yung gumawa ng midterms ninyo, iba yung level of difficulty, iba yung questioning. So you cannot compare those scores. Pinaka-importante na part ng diagnostic midterm finals is the percentile rank. Kasi parang NMAT yan. Okay? Parang NMAT. 100 kayo nag-take, if you place at the top 60, you're doing good compared to 40 other people. You place at the bottom 20% in terms of the percentile rank, it means marami kang hahabulin. Because there are 80 people ahead of you kung 100 yung kumuha ng exam. Now, that being said, okay, ang NMAT, napansin namin, some people have taken the NMAT several times, 2 or 3 times. Napansin namin, hindi siya consistent, yung mga NMAT scores na nakukuha nila. Pwede yung basta isang NMAT, 20 ka. Then yung next NMAT na kinuha mo, next attempt mo, nagiging 40. The same way with diagnostic midterm and finals. Kung mapapansin nyo, hindi consistent yung percentile rank ng mga tao. Halimbawa, 95 ka, and then the rest, 95 yung percentile rank mo. So ngayon, okay, this is how you view those diagnostic midterm and finals. The one that is important is the percentile rank. Okay? Green is always better than red. Okay? May mga magyayabang syempre sa Twitter, sasabihin niya, tangina, ba't ako naka-red all the way, pasado pa rin. Yung kaibigan ko, green all the way, bagsak. Those are statistical outliers. If you parang sinabi mo na, Doc, bakit yung kaibigan ko, Yossi, ang taba, hindi nag-exercise, hindi natapos sa puso. Si Carl Abelo, nagmamarathon, payat, hindi naninigarilyo, deads at 42, heart attack. Ergo, hindi risk fact, guys. Population, mathematics, statistical correlations, green is better than red. High percentile rank is better than low percentile rank. That being said, okay, ang pag-take ng boards, hindi dapat solely nakabase sa percentile rank ng diagnostic midterm finals. The same way that when you accept students in med school, hindi lang dapat NMAT ang basis. It's just one. So should you take the exam based on the percentile rank diagnostic midterm finals results alone? No. Ano yung dapat iba nyo pang basis? 1, mentally prepared. 2, physically ready. Wala kang sakit-sakit. 3, alam mong binigay mo na lahat. Yung parang, Doc, red talaga ako all the way, pero tangina, ganito na lang talaga yung capability ko eh. Nag-aral na po ako as best as I can. Wala na po ako maibibigay pa. Piniga ko na po. Okay? You take this all into consideration. You get opinions of multiple people. Mentor, mother goose, my advice, personal opinion din, your parents, your friends. Okay? Based on my final diagnostic midterm scores, based on my level of preparation, based on my physical and mental health right now, should I take the med boards? That should be the basis. Not really just one factor. Okay? So, you are a physician, you're doctors, you do this the scientific way. Diagnostic midterm finals, importante yan. Okay? Pag tinignan mo palagi yung nasa top 10, ilan dyan yung babagsak? Guys, virtually wala. Yung nasa top 10 ng ano natin. But if I look yung pinaka nasa bottom 10, mas mataas yung probability. It's all math. Percentile rank does not lie. Okay? Group of 100 people, okay, some will get higher grades. They perform better than the other people. But it should not be the sole basis. Multiple dapat ang basis for taking the med boards or not. Coordinate with your mentor. Seek the advice of your mother, of your friends, of your parents. Personally, if you ask me, Doc, take the March or skip? The highest chances to pass is always closest to your internship year. So if you can take the exam as soon as possible, take it. Kasi pag palayo ka ng palayo sa internship year, ito hindi na-appreciate ng students eh. Pag palayo ka ng palayo sa internship year, nakakalimutan mo na yung knowledge and skills mo ng internship, which is actually something that you need to pass the med boards. And yung self-esteem, yung bumababa din. So better to take it as soon as you can. That being said, some of you, 10% of the population right now in Top Notch have finished internship January 31. So medyo, Doc, 4 weeks ba kakayanin yung med boards? Kaya pero mahirap. For those people who have finished the internship January 31, use the finals as one of the basis. If you got a green, kapag aral ka kahit paano all the 12, baka go. Pero kung hirap ka, 4 weeks lang ang aral tapos mababa yung red, naka-red, baka you might have to ask the opinions of other people. Have a holistic approach kung paano i-assess yan. Okay? Jonathan, something to add as a recent report taker regarding diagnostic midterm finance? Regarding when to take the med boards or not?
Yes, ba? So, yun nga, as you mentioned, dapat holistic talaga yung approach to deciding for yourself whether to take the med boards. And yung decision na yan ultimately is up to you. Now, there are different factors na you should look at whether or not you should take the board. So, meron akong mga batchmates na parang what do you call this? Na tatakot talaga sila to take the boards. Kasi one, hindi masyadong consistent yung aral nila. Nahihirapan sila to grasp the concept. So kahit nagbabasa sila, feeling nila hindi nila na-retain. Which is, again, a normal feeling when you're studying for the PLE. Now, it would really depend on how you are mentally prepared, because meron akong mga kakilala na di pa sila super 100% ready, but they risked it and pumasa sila ng boards. Meron din akong mga kakilala na hindi pa sila 100% ready and they took it, but they didn't make it, unfortunately. Pero yung hindi pa siya 100% na nabigay na, yung 100% na nabigay na lahat, may positive outlook din naman siya doon sa pag-take niya, because sabi niya na if hindi siya nag-take nung boards, 100% na hindi siya papasa. Pero kung nag-take siya since nag-take siya ng boards, may chance na papasa siya. It's always a gamble that you have to take, and it depends on your personal situation and how you handle failure if ever it arises. So, yung ganun, I would really recommend them to reflect kung kaya ba nila. Kasi I think most of the people don't want to, ayaw nila ulitin na mag-aral ulit for the PLE. Kasi honestly, it's very taxing eh. It's very taxing, especially if you've been studying for the PLE for the past 2 to 3 months na sa dulo parang isip mo na lang, sige, tapusin na natin to. Ayoko na. I don't wanna go back to this kind of system na everyday aral ka. Na even if minsan masaya naman mag-aral, pero there comes a point in time na masasaturate ka, ayaw mo na talaga mag-aral. So, for some people, they would risk it because ayaw na nilang ulitin pa. And most of those naman na tingin ko, kahit di nila nag-give yung 100% nila, mapasa naman. But again, there's always a risk, no? Always a risk na hindi ka papasa. And you should be prepared to lose that gamble.
Okay, question for Carl. Ano tayo? Maganda tong na to sinabi ng student. So I'll just be reading the questions given by the students. They're very nice. It's a good way to reflect. Good evening, Doc. My question po me, a 7th taker for this coming PLE. How will I be able to get over the crippling self-doubt and absolute lack of self-confidence which came from failing on my first day? Context lang po, I took it for the first time last October with me feeling somewhat unprepared. I was almost ready to face the music on the day the results came out, but then came the huge surge of disappointment in myself and the loss. I think a lot will be able to relate to this po, lalo na from high school. Doc Carl, your advice? How to get over crippling self-doubt, absolute lack of self-confidence as a retaker?
Mhm. Um, hmm. I think, Doc, ang isipin.
Have you guys ever failed
ah,
sa buhay ninyo? Baka wala kayong experience kasi sa failure, academic.
Meron. Not, yung, kasi I don't think most people know it, pero I have written about it. Nag-leave kasi ako sa med school.
Okay.
So, one sem lang ako sa UP Med. Tapos, parang naisip ko, gusto ko ba talaga maging doktor? Kasi yung parang especially with yung sa UP system na organ system na after na kasi 'di ba sanay tayo na one semester tapos marami kang exams for that subject. Yung sa akin kasi naalala ko noon nung first semester kasi UP Med. Pumasa lang ako dahil nag-curve. Tas parang that was the first time na naisip ko na parang oh no, I don't think I'm ready for this or I don't think I'm smart enough for this. So ang lala nung anxiety and self-doubt ko nun parang kaya ko ba talaga to? And yun, yung for me nag-leave kasi ako ng medicine for after one semester kasi I just wanted to see if yun ba talaga yung gusto kong gawin. And dun nagturo ako sa MBB after nung naglowa ako and bumalik ako with a renewed sense na yun talaga yung gusto kong gawin in medicine. It's hard to overcome anxiety and depression sa totoo lang kasi parang feeling mo na hindi kasi I think for most people naman na nag-med, achiever ka for most of your life. Diba? Parang rare naman siguro yung nag-medicine ka na sobrang baba talaga ng grades mo nung high school and college. So since nakarating ka sa med school, you have to remember na compared to the general population, matalino ka. That's one thing that for me helped me with yung anxiety and depression ko nung nag-leave ako from med school. Parang it took me a while to realize na, compared to the general population, yung mga nandito sa Zoom right now and nakikinig sa portal, you are smarter than the general population. You just don't feel it because in this cohort, diba, lahat tayo more or less above average. So, personally, yeah, I have struggled with anxiety and depression in the past. And the important thing is to reframe yung na parang yun nga na it's a setback, but most of us aren't used to setbacks. Dapat ma-realize natin that everyone will fail at some point in their lives. Pwedeng hindi academic, pwedeng sa relationship nila, sa family nila, sa personal life nila. It's inevitable that you will fail. And yun yung kailangan mong i-accept. Na pwedeng hindi sa PLE yung failure mo, pwedeng sa relationship. And you just have to be able to accept that failure is a part of life. And from there, you have to move on. You have to get your bearings and do your best next time. Sorry, yun lang yung perspective ko on that. Meron ba kang addition doon, Carl?
Carl, your thoughts on this?
I think pag kasi nagkakaroon ako ng I think marami akong failures I think nung residency. Kasi I've known myself na parang siguro may kakaiba akong pride noon time na yun dahil syempre fresh off the PLE na nag-rank 3 pero nung residency parang ako yung worst resident in terms of managing patients. So parang hindi ako nakaget over doon sa ego ko na yun. But I think yung self-doubt and yung anxieties mo, minsan minsan ego problem siya, meaning hindi mo matanggap sa self mo na nag-fail ka. Pero tandaan mo, and this is also the thing na lagi kong sinasabi sa self ko pag I fail at something is or I didn't get what I wanted in life. Ang lagi kong iniisip is na nangyari na in the past. Ang lagi kong iniisip is there's no amount of crying, whining. There's no amount of wishing na God had favored you nung time na sana pumasa ka. There's no amount of sulking at the corner of your room. There's no amount of anything na mag-change nung past na yun. Wala talaga. No? There's no way na mababago mo yung past na yun. Pero tandaan mo, may magagawa ka ngayon. May magagawa ka ngayon, may magagawa ka for your future. And for that person na nag-doubt sa self niya dahil this will be his or her second take, and yun nga na parang ayaw niya na ulit mag-fail dahil hindi siya nagandahan dun sa kanyang diagnostics, midterm or finals. Yun, maliban dun sa dapat nga is holistic yung take mo kung mag-exam ka or not ngayong March. I think aside from those things is alalahanin mo, you miss 100% of the shots that you don't take. So kung hindi ka magte-take ng exam ngayong March, kung first taker ka man or second taker, there's no way na malalaman kung papasa ka or not. But again, syempre, kailangan may wisdom pa rin behind sa pag-decide mo, which is kailangan may, kunwari, kung red ka sa diagnostics and midterm, medyo mag-isip ka pa magte-take ka or not. But then again, marami kasing stories nga na red sa diagnostics, red sa midterm, nag-green sa finals, nag-take, pumasa. And meron din naman na dalawang green, isang red, hindi nag-take, syempre hindi natin alam kung papasa siya sana. So again, very nuanced yung decision making kung mag-take ka or not . Kasi nung time ko, meron akong mga classmates sa West na, kasi syempre sabay-sabay kami nag-take ng PLE na I think 3 red siya. Pero dahil kilala ko siya, yung guy na yun, kilala ko siya as person na wala ba siyang pakialam. I mean, wala siyang pakialam kung bumagsak siya or not. Basta mag-take ako kahit 3 yung red ko. And pumasa siya. No. Yun kasi yung yun yung mahirap i-explain na kahit 3 yung reds is pumasa. So, pero siguro dahil prepared siya and he's willing to take that risk na bumagsak na. No. So it depends talaga. But again, yun nga, I have to use yung principle ng statistical probabilities na if you have more greens than reds, edi mas higher yung chance na papasa ka. No? Pero again, that's just yung numbers na nagsasalita. So you also have to take into account yung emotional and emotional preparation.
Okay. Some lessons that I've learned. Top-Notch has been here for almost 2 decades na. Med school never teaches people how to process failure and how to process test anxiety. It's parang a mindset sa medical schools. It's something that's handled at the level of an adult as an individual. Kaya parang we don't want to talk about failing the med boards. Okay? That's why titinan mo yung mga memes na nasa Twitter. It's manifest. Ganun . Well, let's not talk about the possibility of failure kasi bad juju, baka bumagsak talaga tayo. Pero kasi guys, honestly, sa buhay, babagsak at babagsak ka. Whether it's on med boards, in love life, in something else. No one wins them all. You win some, you lose some. So, sa board exams, I can just imagine, kasi nung nag-aaral ako sa med boards ko, Carl, Jonathan, ayaw ko ring bumagsak eh. Kasi alam kong 25 years from now, pag-uusapan ng mga kaklase. Tapos alam ko, madidelay yung pagtatabaho ko para makatulong na sa parents, mga ganong stuff. So, I can just imagine, if I fail that exam, the disappointment, the damage, the hit in self-esteem it will impose on me. It's hard. Some practical tips to get over that loss of confidence. Stay away from people na bad vibes. Yung ihirita ka pa na, tangina, ba't ka bumagsak? Di ka nag-aral, no? May mga ganun eh. Surprisingly, if I was monitoring mga conversations sa mga tao, I actually felt before that no one will do such a cruel thing. Nahihiritan mo in any way, isang taong bumagsak sa med boards. Ang sinabi mong namatayan, nagkasakit, buti nga, parang ganun eh. Ganun ka-evil eh. It turns out there are people who do this. Sometimes it's the sibling. Sometimes it's, unfortunately, the parents. Heartbreaking. Okay? Practical advice is stay away from those people as much as possible. Second is you really need to, more than anyone else, you need to be your number one supporter. In high school, college, magaling ka. You need to find that spark, that love for knowledge, that confidence na magaling ako, nadapa lang ako. Itong past, wala na ako magagawa, I'll just learn from it. I'll concentrate on what I have to do for the present. I'll prepare for what I have to do for the future. Okay, that's one way of trying to psych yourself up for it. Probably, if I were in your position, pinakagagawin ko niyan, instead of focusing on possible outcomes, kasi mababaliw ka niyan eh, babagsak ba uli ako, gagawin ko to for another 6 months. Papasaba ako nung mararamdaman ko. Instead of focusing on what might happen, you focus on the process. Ano ang kailangan kong gawin today para mapasa na to? So kailangan ko aralin to. Let my whole concentration be on the task that I have to do today. Let me concentrate on the process and not on the possibilities. Okay? Prayer will help. Going to mass will help. Okay? Having superstitions sometimes will help. Manifest to death sometimes will help. Your choice, guys. Okay? But the process of processing failure, right now, it's really an individual personal thing. You need to psych yourself up for that. Okay? Pinag-usapan sa Facebook, sa Twitter a few months back. Sinabi ko na kapag bumagsak ka, tapos kumuha ka uli ng boards, tapos pumasa ka, nawawash out lahat ng bad experiences, bad juju, bad memories to be replaced by happiness na ngayon pasa ka as if first time mo nag-take. And one student actually asked, is that true? I can only speak for the students that I saw. Okay? Medicine is such a busy place and full of mga redemption arcs na bagsak ka ng boards, nag-residency ka, tapos naging chiefess ka, you forget about it. Okay? Were not accepted in residency. Eventually, you get accepted in another hospital, another specialty. You became a very successful consultant. You forget about it. Okay? So itong process na bumagsak ka ngayon, guys, seryoso, pag pumasa ka, wash out. Ngayon, kung may retain, kung may hurt pa na, will I be looked down as a resident? Parang parang a different ballgame na yung residency. So, it's a fresh start for everyone. If you're asking, Doc, will it damage my application for residency kung bumagsak ako sa boards? Mas magandang tanong yun. Based from what I know, guys, most hospitals will actually just ignore your grades in the med boards. Ang papansinin is yung grades niyo during med school. Okay? In terms of yung pass or fail sa board exams naman, na tinitingnan nila, nag-top ka ba o hindi? Kasi pag nag-top ka, may additional points yan sa residency application mo. Will they look at your grades? Halimbawa, Doc, 85.99 yung average ko, yung katabi ko 82.99 sa med board. So they take that into consideration. Not a lot of hospitals will do that. Actually, some hospitals ang tinitingnan nila, line of, ano ba, 80 ba ang average yan above? May plus points. Not 79 and below, may ganitong strata na points. Ganon yung nagiging basis nila. Nag-take ba tong ng board exams 2 times, 3 times or more? I haven't heard any hospital actually do that. Kasi alam nila, paano kung malas yung estudyante? Mas importanteng makita yung performance niya, yung med school. Actually, yung GWA niyo ng med school, guys, yun yung biggest na ano dyan. Aside from yung entrance examination na pwedeng ibigay sa inyo. So don't worry too much. Retaker, you worry about the process more than you worry about the possibilities. Okay? We'll burn the bridge once we get there. Okay? We'll burn the bridge once we get there. Pag napasa nyo yung board exam, saka natin pag-usapan nyo, okay, tactics na tayo. Paano ba ang tunay na buhay? Paano ba ang lakaran sa residency? Paano ako makakapag-fresh start? Okay? Let's leave that for another day and focus on the process. Okay? Your thoughts, Carl, regarding this?
Dun, Doc,
sa
sa
residency nila, sa application, as a resident yourself before?
Actually, Doc, kasi kasama sa grading na kung i-accept si applicant, kasama sa grading yung, and actually malaking factor yung performance niya sa pre-residency. So actually, so maliban sa GWA is yung sa grades mo sa PLE na yun nga, hindi din naman actually, hindi ganun siya kalaki compared to, okay, yung score mo sa PLE kung i-accept ka sa residency is hindi ganun kalaki yung impact compared to performance mo sa pre-residency. Kasi mas i-accept and mas papaboran ng mga residents kasi kasama yung grading ng residents ng current residents, kasama yung sila yung mag-grade dun sa pre-resident. Malaki yung impact ng grading ng pre-residents. Malaki yung impact ng grading ng mga residents dun sa pre-residency period. Meaning, kaya mong bawiin yung sinasabi mo na second take mo ng PLE, kaya mo yung bawiin ng sipag mo sa pre-residency. No, kung maasahan ka, kung teachable ka, kung hindi ka sumasagot sa resident or nagagawa mo lahat ng tasks dun sa patient, hindi mo sila iniiwan, no, marunong ka mag-manage, may work ethic ka, mapasok ka early, lumalabas ka late, no. Kung mapakita mo yun during pre-residency is mas malaki yung chance mo na ma-accept kahit na ikaw ay second take, no. So I think ang point ko lang is there is more to life than yung second take mo. Kasi mas malaking impact ng or yung weight ng performance mo sa pre-residency period. Kasi ipakita mo lang na masipag ka dun.
May bawi talaga. Maganda sa med, gusto ko. May redemption arc palagi. Whether at the level of med school, at the level of residency, level of a consultant. Okay? So much stories. Ang dami kong pwedeng ikwento sa inyo. But let's save it for another time. Yung mga comeback stories namin since med school from me and other students whose stories I know. Let me just answer quickly. May mga questions pa dito. Some of them I'll answer. Some of them pa-answer natin kina Jonathan tsaka kina Carl. Doc, I would like to ask a question po. First time retaker, October 2022. 2 points short of the 75% cutoff to pass. Consistently green, red, had improvements of the topics covered, videos, practice tests. Anxious pa rin? How will the takers deal with this? Again, that's anxiety of the unknown. Hindi mo alam kung papasa ko. Walang makakapagsabi kasi guys Parang pag tinanong niyo ako, Doc, tangina, papasa ba ako? Oo, hindi. I don't know, Doc. It's all up to you. We really cannot say part of it is within your control, part of it is outside of our controls, outside of both of our controls. What's the one within your control is the process, what you have to do for today and for the next 24 days. So you focus on the process and not on the possibilities. Okay? Next. By the way, guys, yung 2 points short of 75% cutoff. So I think the student here is referring to a average of 73%. Guys, hindi ganun yun Okay, hindi ganun yung mathematics niya 73% na average is actually several points in terms of raw score far away from the average. Okay? May mathematics yan. Explain ko na lang pag malapit na yung boards. Question po, Doc. Natapos ko ang handouts and lecture videos bago po mastery period. Good for you. Pero at this time po, 3 lang po ang practice test ang nababasa ko per day for each subject. I am trying to get back into the handouts pero naubos ko ang whole day for the 3 practice tests alone. Do I need to go back po for the handout or ulitin ko po ang 3 practice test flashcards? Ano po kayang ma-advise nyo na study technique? Thank you very much. So dito, Doc, nilump nila. We already gave them 3 sets of practice tests. One is based on the handout, the other on the past boards last year, the other is on the boards no October 2022. So I think ang ginawa niya is binasa niya na lahat ng main handout, main video lecture, tapos ngayong mastery period, 300 items na practice test per day yung ginagawa niya. So hindi na daw niya mabasa yung main handout. Jonathan, having taken the program noong October, good, bad?
Okay, sobrang good nun na natapos na yung video and handout before the mastery period. Personally kasi I guess most people din naman parang it's so hard to be able to retain yung information and then watch the videos and finish the handout. So personally ako, halos clutch ko lang talaga natapos yung handouts nung malapit na yung boards because there's really a lot of information that we need to cover. And if may subset of people talaga, I know some blockmates who were able to stick to the schedule. And I think if you're able to stick to the schedule, lamang ka na talaga eh. And the fact that tatapos mo na siya and now you're focusing on the practice tests means that you can now integrate better. So if mostly practice tests yung nagagawa mo and yung scores mo sa practice test are good, and then that means na minimal na lang din yung babalikan mo yung sa handout because the reason naman bakit mo babalikan yung handout is for reinforcement. Now, yung babalikan mo dun sa handout wouldn't be everything if okay naman yung scores mo dun sa practice test. Yung babalikan mo yung mga mali mo para ma-correct mo yung mga mistakes mo, yung mga misconceptions mo. And from there, you learn from it better. I think that's a better use of the time. There are some people talaga who are able to stick to the schedule of top-notch. And I think yun yung time by nung last year, yung may mga, yung schedule may A and B, parang may ganun ka ba?
We've simplified the process for this batch. Next batch, may nag-iisipan na nga namin na much simplified process pa. Tapos may integration ng online, on-site na matino para mas pasok. Okay? For Carl, respectfully, Doctor, would like to ask for an advice regarding flashcards. What if I wasn't able to read the flashcards because I am a slow reader? How disadvantaged would I be, Doctor? Because I'm kind of anxious. I wasn't able to read the flashcards and I still have backlogs. And I'm getting scatterbrained with my sched because of it, Doctor. Your response is very much appreciated. Do you do flashcards, Carl? Do you recommend?
Well, nung time ko kasi Doc, nung 2017, parang ang flashcards lang na uso noon yung sapato. Yung inaano sa Brainscape, kung tanda mo yung Doc. Yun lang yung merong flashcards kami.
No?
So, I think, natapos ko yung flashcards na yun. Nagpa-flashcards ako. Pero, ang nakita ko kasing limitation nung flashcard. Well, for me personally, hindi ko naman to generalize. Pero kasi ang nakita kong limitation ng flashcard is yung konti lang, yung kaya mo ilagay dun sa likod ng flashcard. And as opposed sa kung practice test siya, meron kang 4 options. And dun sa 4 options na yon, I mean, kunwari, alam mo yung tamang sagot dun sa out of the 4. Yung other 3, pwede mong i-explore yung kung bakit sila ang hindi sagot. There's a reason, there must be some reason kung bakit sila included in the among the choices, no? But yeah, so pero tsaka kasi for me yung practice, parang mas gusto ko mag-train or mas gusto kong mag-practice, mas gusto kong mag-practice ng kung anong, paano ko ba sabihin yan? Kumbaga, mas gusto ko na mag-practice test kasi yung ite-take ko na PLE is exam na ang format is question stem, 4 options. So, kaya mas gusto ko i-train yung self ko na magsagot lagi nung thing na ite-take ko, nung exam na ite-take ko, as opposed sa flashcard. Kasi pag flashcards is, well, parang, ano pa rin naman siya, form of active recall pa rin naman. Pero yun, parang hindi ako masyadong napapractice doon sa format ng exam. Pero if nag-work sa'yo naman yung flashcard is well and good, no? Pero to answer yung question na kung magiging at a disadvantage ka ba kung hindi mo nadaanan yung flashcards, I think not necessarily naman siguro. I think kung may magawa ka mang either of those, either flashcards or practice questions, kung matapos mo yung either of those, maganda yon, no? Ang masama is wala kang nagawa dun sa, hindi ka nakapag-practice question or hindi ka rin nag-flashcard. Like 3 beses ka lang nagbasa ng handout. Yun yung mali dun. Kasi, again, hindi naman lalabas lahat ng nasa handout, no? Ang lalabas is yung high yield na nasa handout. And the way na malalaman kung sino yung high yield dun sa handout na, again, yung handout kasi na yan is high yield na yan. So, sino yung pinaka-high yield of those na nandun sa high yield na handout? So, malaman mo ngayon is using practice questions or yung flashcards. But, and again, you can do either of those, no? Ang masama lang is wala kang ginawa dun sa either of those, no?
Okay, 7 minutes to go. Let me answer quickly some of the student questions. Doc, what is a good safe practice test score po? Your practice tests are given 100 items at a time. News from the grapevine is that the MPL for most of the subjects is in the 50s, anywhere from 51 to 59. So a good strategy or a good tactic here is ang target nyo dapat sa mga practice tests is to get 60 and above. Kasi pag 60 and above, it means kahit paano, whether the MPL is 51 or 59, natamaan mo na yon, na-reach mo na yung target nilang MPL. Based on experience, probably if you had practice test at the start of the program, you'll get scores na 40s. And then tataas yan to 50s. Probably 50s na yan at this stage. And then if you take another practice test close to the boards, dyan papatak yan ng 60 to 70. You will receive from Top-Notch 4 practice tests. Yung pang-apat is based also on the feedback ng past med boards nung March 2022. So be prepared. Inuunti-unti namin yan. Nakahanda na actually. Dinadahan-dahan lang namin. Okay? 4 set. Eventually, we'll be using 5 sets of practice tests. Eventually, we'll be using a test bank na may software. Inaayos lang namin yung dynamics. But for now, for the students ng March 2023, 4 sets ang nakita namin na sufficient. So, unti-unti guys, may isa pa kayong round pag malapit na yung boards. Okay? So, target grade of 60. Next. Doc, if for mid-years, hindi nakatapos ng main handouts, will you advise us na lang on topics? To focus na lang on topics sa pre-test? Thanks po. We have a recommended schedule for those who have finished internship noong January 31. Get in touch with your mother booths. Find out kung ano yung schedule na yon. As much as possible, you stick with, may mga iba-ibang tactics yan eh. Yung iba pearls lang, yung iba main handout lang. tingnan ninyo kung ano yung nirecommend ko. Plinano na yan. Remember, nung November, nag-meet ko na yung mga magmi-mid-year, telling them about yung proposal, okay, yung plans for that. Use the finals to assess, talk to your get a mentor, okay, to determine your readiness for the med boards as one of the holistic approach natin. Okay, next. Good evening. If hindi pa po nakapag-handout, nakapag-video po, few practice tests and few flashcards, babalikan pa po ba yung handout or tapusin na lang namin yung backlogs? Thank you po. First time to take this March po. Main handout, main lecture, flashcard, practice test flashcards in order. Yun yung pinaka-importante. So main handout, then the main lecture video. Some people have sacrificed the lecture video for the main handout. I would only recommend doing that if you've got high scores, high grades during med school. For most students, it's really kailangan alam yung ine-emphasize ng teacher, yung mga side notes niya. Tingin nyo importante, importante yun. Panoorin nyo lang yung kay Dr. Lubomir Antonio para alam nyo importante yung lecture na kasabay ng handout eh. Kaya yung lecture ko sa Fisho, mas ma-appreciate nyo kung nandun yung QR codes na panood nyo plus yung lecture video. Mas papasok yung concepts and principles. So try to, ngayon, kung magsasakripisyo, it depends on the person. Some will actually score better if main lecture video, tinira nila. Others will score better with the main handout. Some people, ako personally, alam ko na, mas na-retain ko pag naririnig ko eh. Tsaka napapanood ko yung teacher rather than binabasa ko. Other students, usually, yung mga students with higher grades in med school, they really prefer reading over watching videos. So if Felix Rubio, hayop na yan. Nagtuturo sa Top Notch, hindi nakapanood niya ng isang video sa Top Notch. Handouts lang siya all the way, plus mga review books. Some people are like that. It's okay. Basta parang ano yung pagkain yan eh. You can eat the appetizer first. You can have dessert first. End of the day, same calories. Okay? Next. Asking for a friend, what if wala pa pong natapos kahit isang subject? Backlogs ko talaga. Anong mas better gawin? You do what you can with what you have where you are. Coordinate with your mother, who's mentor. Create a feasible schedule. Stick as much as possible to it. Take the finals to assess. Next, what is good evening, Doc? Super slow reader po. Ay, hindi. Yung flashcards yan. Videos na lang po. May issue po ako sa retention, recovery of information. For people who feel that they're slow reader or they're not retaining information, guys, you're thinking kasi na ang utak ng tao parang computer na parang nag-USB lang, kinopyahan mo ng ano. You're thinking of a passive transfer of knowledge from handouts, lecture videos to your brain. The brain doesn't work that way. Yung tinuro sa inyo ni Carl, ni Jonathan, at the start, you have to apply. Question yourself, reflect on what you're reading. Okay, active process ang learning. You really apply that. Hindi bullshit yung active learning, hindi yung decoration. Panoorin niyo yung video on how to study. Panoorin niyo muna ngayon. Kung feeling mo mabagal ka magbasa, mabagal attention, panoorin niyo muna yon. Then i-apply ninyo. Okay? It will take some time to practice those good habits, but you will be able to utilize and become better. Okay? Next, sobrang takot po ako. Third take ko na. So far, green po yung 2 midterms ko, but I am not confident po. No one is. No one, not even Tiffany Uy, the valedictorian ng class 2020 sa UPPGH, not even her was confident for the med boards. There's really anxiety. Paano kung minalas ka sa med boards one way or another? We live with uncertainty. Okay? That's one of the things na, alam niyo yung adulting na pinag-usapan natin? Kasama yan. Processing uncertainty. In an uncertain world, you focus on process, not on the possibilities. Because otherwise, you'll be paralyzed with thinking about these possibilities. Psych yourself up. Okay? Next, slow learner. Only recently found a good way to study. Focusing on handouts. Good sense of relationship. Should I keep it po or more practice question, memorization for the pearls? Keep it up first. Yung pearls natin is for reinforcement. And, hindi ko lang binabanggit sa inyo, after your pearls, may time pa kayo to do practice test. Yung 5 days, pagitan ng day 2, day 3 ng medboards, practice test time din yun. Okay, mga buffers natin yun. Huwag nyo munang i-maximize. Okay? Basta, gusto ko lang alam nyo na may buffer pa rin. Next, meron po bang instance sa medboards na conditional yung result, like pass yung GWA pero one failed subject? Thank you po. The rule is you have to get an average of 75, no grade lower than 50. You get an average of more than 75, you have a grade lower than 50 in one subject. Happens several times, may 49, kahit yung average nila 80. Minara sa one of the subject, you won't pass. Okay? Next. Natapos ko po most of the vids, but marami pong backlog sa main handouts, di ko pa na-read. Yung med flashcards, content practice test lang, ano pong gagawin. Again, do what you can with what you have where you are. Create a schedule with your mentor, Mother Goose, on how to address the backlogs. Okay? For most students, we would recommend at least going through the main handouts twice, going through the main videos at least once, going through the pearls at least once. Okay? Practice test at least once also. Okay? Do what you can where you are with what you have. Okay? Sa top-notch, ino-over-prepare kayo. So kahit hindi nyo mabasa lahat yan, mapanood lahat yan, you still have a fighting chance. Next. Same po ba pearls, buzzwords, content? Retaker, no. Magbabago yung iba. Not all will be the same. Okay? May mga new teachers din for those. Got to do gauge my time management during the pearls. Okay. The pearls, ang gimmick dyan guys, sabay ang handout sa video. Hindi mo papasahin muna yung pearls handout, then manood ka ng lecture video. No, sabay yan guys. Yung pearls na yan has not changed in terms of style since 2007, since we started. Okay, may lecture talaga, habang nagle-lecture, yung buong handout ng pearls kino-cover. It's what works for the students. Do that. Okay? Final words, Jonathan and Carl. Tips for our students. We might meet one more time immediately before your med boards. So advice, one line, Jonathan, Carl. Jonathan first.
Si Doc Carl muna.
Sige. Carl?
So siguro ang last na line of advice ko is itong laging yung paulit-ulit na sinabi ni Doc Broly na huwag ka na mag-dwell doon sa past na lahat ng nasayang mong oras, kung meron ka man nasayang oras na hindi mo naaral or whatever, or kung nag-fail ka man dati. And wag mo na isipin yung yun nga na pwede ka mag-fail ulit or pwede ka mag-fail if it's your first time. Mag-focus ka lang talaga on the present, no? And kung ano yung dapat mong gawin ngayon. Kasi pag ginawa mo lahat ng dapat mong, for example, nagplan ka and then ginawa mo in-accomplish mo yung mga stuff na nandun sa schedule mo, you focused on what you need to do for this hour, for this hour, for today, at this moment, the score will take care of itself. Huwag mo na isipin kung ano yung pwedeng maging outcome. Basta mag-focus ka lang sa kung ano dapat mong gawin ngayon.
Okay. So for me naman, yung gusto kong i-emphasize to everyone is that, yun nga, yung quote from, I think si Franklin Roosevelt yun, a smooth sea never made a skilled sailor. So marami talagang magiging challenges, especially in the last 25 days before the PLE. And kailangan mo lang siyang tanggapin na ganun talaga siya, and do what yung na-mention nga ni Doc Broly na do what you can with what you have where you are. Because we can always say na sana ganito, sana ganyan, pero hindi nga eh. We're here right now. Focus on the now and with what you can do at this moment. Don't dwell in the past na parang sana the past few months mas nag-aral ako. Sana nung internship nag-aral na ako. I mean, I've had those thoughts nung palapit na yung board, sa parang shock, sana nung internship mas kahit toxic nung rotation, sana nagbabasa na ako, sana like yung iba na to take ngayon March na nag-review na rin for the October boards. Parang sana mas mahaba yung time ko for studying. Sana mas nag-devote ako ng more time studying. Well, it's already done, no? Don't dwell in the past and focus on what you can do now. That's all.
Thank you so much, Jonathan and Carl. Back to you, DK.
Thank you very much, Doc Carl, Doc Jonathan, of course, Doc Broly, for all your tips, suggestions for our students, for our dear students, for the last 25 days before their PLE. I'm sure, ako rin natuto sa mga not only for students, but about life and in general, di ba? I'm sure they will apply this. So thank you very much, doctors, for your time and for your help for tonight. So ayan mga bees, sana magamit niyo yung mga tips na binigay ng ating mga doctors. I will see you 8 o'clock, okay? For your QM and IM. Alright, so see you. Dinner muna kayo or something. Okay.
Thank you, Doc.
Bye.
Yeah, thank you, everyone.
Thank you, doctors.
Louie, padala ng dinner si Jonathan at si Carl. Thank you, guys.
Thank you, Doc.
Walking alone on the shores of longing, I miss your footprints next to mine. Sure as the waves and the sands are washing, your rhythm keeps my heart in time. You found me, made me into something new, led me through the deepest water. I promise loud to carry on for you. I'll carry on for you. Spoke to the wind on the open ocean. I wonder if you hear me too. Wrapped in my arms with every moment, the memories that pull me through. You found me, made me into something new. Led me through the deepest water. I promise loud to carry on for you. To carry on for you.
I can't quite get you out my sight. You're always just behind. These thoughts cross my mind. Keep crawling back to where we last left our love on hold. I'm always out for more. So what you waiting for? Wait before you burn me to the ground. Please stay till the beat of my heart runs out. I don't wanna let go, 'cause I've been trying to hold on for too long. I feel like I'm lost without a trace. Take my heart and run away. She said, I've been looking for a lasting lover to save me from every single heartache. I feel like I'm lost without a trace. Take my heart and run away. She said, I've been looking for a lasting lover. She said, I've been looking for a lasting lover. One by one night, two by twice, I've watched all my loves move on to something more. Open out the door. Caught in between every passing hour. Oh, please stay till the taste of your mouth turns sour. I don't wanna let go, 'cause I've been trying to hold on for too long. I feel like I'm lost without a trace. Take my heart and run away. She said, I've been looking for a lasting lover to save me from every single heartache. I feel like I'm lost without a trace. Take my heart and run away. She said, so let me know, did we ever mean anything at all? So let me know, did we ever mean anything at all? I feel like I'm lost without a trace. Take my heart and run away. She said, ooh, I feel like I'm lost without a trace. Take my heart and run away. She said, I've been looking for a lasting lover. I've been looking for a lasting lover. Oh, I've been looking for a lasting lover.
We were good, we were gold. Kind of dream that can't be sold. We were right till we weren't. Built a home and watched it burn. I didn't wanna leave you, I didn't wanna lie. Started to cry, but then remembered I can buy myself flowers, write my name in the sand, talk to myself for hours, see things you don't understand. I can take myself dancing, and I can hold my own head. Yeah, I can love me better than you can. Can love me better, I can love me better, baby. Can love me better, I can love me better. Paint my nails cherry red, match the roses that you laid. No remorse, no regret. I forgive every word you say. Ooh, I didn't wanna leave you, baby. I didn't wanna fight. Started remembered. I can buy myself flowers, write my name in the sand, talk to myself for hours, say things you don't understand. I can take myself dancing, I can hold the morning, I can love me better than, I can love me better than you can.
LA on a Saturday night in the summer. Sundown and they all come out. Lamborghinis and they rented Hummers. The party's on, so they're heading downtown. Everybody's looking for a come up, and they wanna know what you're about. Me in the middle with the one I love it. We're just trying to figure everything out. We don't fit in well, 'cause we are just ourselves. I could use some help getting out of this conversation. Yeah, you look stunning, dear, so don't ask that question here. This is my only fear, that we become beautiful people. Top designer clothes, front row fashion shows. What you do and who'd you know? Inside the world of beautiful people. Champagne and rolled up nose, prenups and broken homes. Surrounded but still alone. Let's leave the party. That's not who we are. We are not beautiful. Yeah, that's not who we are. We are not beautiful. True for hours last night and we made it nowhere. Now I see stars in your eyes when we're halfway there. I'm not fazed by all the lights and flashy cameras, 'cause with my arms around you, there's no need to care. We don't fit in well, we are just ourselves. I could use some help getting out of this conversation here. You look stunning, please, so don't ask that question here. This is my only fear, that we become beautiful people. Top designer clothes, front row at fashion shows. What you do and who'd you know? Inside the world of beautiful people. Champagne and rolled up nose, prenups and broken homes. Surrounded but still alone. Let's leave the party. That's not who we are. We are not beautiful. Yeah, that's not who we are. We are not beautiful. We are not beautiful. You never know how good you have it, until you're staring at a picture of the only girl that matters. I know what we're supposed to do. It's hard for me to let go of you, so I'm just trying to hold on. I don't wanna know what it's like when you're gone. I don't wanna move on. I don't wanna know what it's like when you're gone for good. You're slipping through my fingertips, a little bit by a little bit. I didn't know that loving you was the happiest I've ever been. So I'm just trying to hold on. I need to learn how to cope without you. I'm trying to protect myself, but only you know how to. Yeah. Oh, I know what we're supposed to do. Oh, but I hate the thought of losing you. So I'm just trying to hold on. Hold on. I don't wanna know what it's like when you're gone. I don't wanna move on. I don't wanna know what it's like when you're gone for good. You're slipping through my fingertips, a little bit by a little bit. I didn't know the love of you was the happiest I've ever been. So I'm just trying to hold on. Starting to feel like you don't need me. Wanna believe it's all for the better. It's getting real, I'm missing you deeply. So I'm just trying to hold on. Starting to feel like you don't need me. Wanna believe it's all for the better. It's getting real, I'm missing you deeply. So I'm just trying to hold on. Hold on. I don't wanna know what it's like when you're gone. I don't wanna move on. I don't wanna know what it's like when you're gone for good. It's slipping through my fingertips, a little bit by a little bit. I didn't know the love of you was the happiest I've ever been. So I'm just trying to hold on. I'm just trying to hold on. It's such a beautiful night to make a change in our lives. East Anglian sky, empty bottle of wine. I got you by my side, talking about love and life. Oh, how lucky am I when I look in your eyes. What a wonderful way to spend a moment or two. To be lying awake and be here talking to you. I got something to say, I know what I gotta do. To be making a change, now the moment of truth. Why am I feeling so nervous when things are going so perfect? But I know that it's worth it to spend forever with you. And so I count 2, 3 and get on one knee and I ask you, darling, honestly, I've waited all this time just to make it right. So I'll ask you tonight, will you marry me? Just say yes. One word, one love, one life. A gentle touch of the hand, fingers running through hair, lips pressed to her lips, so I was caught unaware. Arms holding me tight, tears in both of her eyes. What a beautiful way to spend the rest of our lives. Sun will reappear, burning auburn and red. My chest was the pillow, green grass lawn was the bed. Last night was the night, one last moment of truth. And what a wonderful way of falling deeper in you. Why was I feeling nervous when things were going so perfect? But now I know that it's worth it to spend forever with you. And so I count 2, 3 and get on one knee and I ask you, darling, honestly, I've waited all this time just to make it right. So I'll ask you tonight, will you marry me? Just say yes. One word, one love, one life.
at the sunroof. I'm blasting our favorite tunes. I only got one thing on my mind. You got me stuck on the thought of you. You're making me feel brand new. You're more than a sunshine in my eyes.
Oh yeah, feels like a never-ending summer with you. Hand surfing out the window in the middle of June. Sunset, sunroof, suntan, all you. Blue skies, green eyes. It feels like I'm driving down the freeway at night. I only got one thing in the back of my mind. Yeah, I'm feeling like this might be my time to shine with you, with you, with you. I got my head out the sunroof, blasting my favorite tune. I only got one thing on my mind. You got me stuck on the thought of you. You're making me feel brand new. You're more than the sunshine in my eyes.
I got my head out the sunroof. You got me stuck on the thought of you. Yeah, we're driving down the freeway at night. I only got one thing in the back of my mind. I'm feeling like this might be my time to shine with you, with you, with you.
I got my head out the sunroof, blasting our favorite tune.
Alright, hello! Welcome back mga BBs! Okay, ready na for our quiz master? Okay, hopefully, you're able to freshen up. Okay, or kumain man kayo. Okay, so, dahil pareho kami naka-red ng ating QM for tonight, okay, introduce ko na siya. So, for our quiz master 2 in IM, we have Dr. Harold Henry Son Sichu, a graduate of UP College of Medicine, and also taught in Top Notch last 2016, so yung essentials yung tinuro ni Doc, and finished his internal medicine residency at Philippine General Hospital, and currently a fellow of endocrinology at the same hospital, PGH. So good evening, Doc Harold. Magandang gabi po. Hi, Doc. Can
Hi,
you hear
good
me po?
evening. Yeah,
Hi, good
I
evening
can
po,
hear
Doc.
you.
The floor is yours na, Doc. We can start. You can share. Wait lang. Stop share ko muna to, Doc. Ayan, you can share na, Doc.
Mhm.
Okay na, Doc.
Anuhin ko lang but i-ano ko lang siya.
Alright, sige po. So, mga
So,
BBs, participate kayo dito sa poll that I will launch para at least ma-practice kayo sa IM. Alright, as usual. Oo, yan. So, pag may mga questions kayo, please use the Zoom box for the questions that you might have for Dr. Chu. Alright, so ito na. Nakashare na si Doc.
So I think you
Alright.
can all see the screen already. So good evening.
Yes,
So
Doc.
good evening everyone. So I'm as introduced by Doc, I'm Dr. Harold Chu. So actually I already graduated from endocrinology program of PGH and already passed the diplomate exam for endocrinology. So I still haven't started any practice yet. So kaya ako nandito, no? So still have a lot of time to do the physician licensure examination review. So tonight we'll be having a quizmaster session. So you'll be answering questions lifted from Harrison's and some clinical practice guidelines. And Dr. DK here will help us facilitate the answering of each of the questions. So after each question, we will be launching a poll. So please participate and take note which questions you already know and which questions you will have a correct answer, and also if you get a wrong answer, please also take note. Then we will provide explanations and also what tables or high yield information you need to know for that specific question. So let's start. So for the first question, so number 1, which of the following is not part of the Caspar criteria?
Poll is ended na, Doc. You can see the results po.
So we can where's so hindi ko makita yung poll result eh.
Sige, Doc, basahin ko na lang po. Yung poll results, majority answered letter B, boy, at 40%, followed by letter D, 34%, and then letter C, 16%.
So for this number, so the correct answer is actually letter B, boy, positive rheumatoid factor. So what is the basis for this? So if you look at chapter 362, there's table 362-2. So this is the classification criteria for psoriatic arthritis, or the Caspar criteria. So for you to meet the criteria, a patient must have inflammatory articular disease, whether it's in the joint, the spine, or enthesial. Then you have to have 3 or more from any of the 5. So there is evidence of current psoriasis, a personal history or a family history. So that's in our choices. Then typical psoriatic nail dystrophy on physical exam. Of course, that patient has to have a negative test for rheumatoid factor, because the diagnosis will change, since rheumatoid arthritis is also an inflammatory arthropathy. So you should have either current dactylitis, yung sausage digits na tinatawag natin, or a history of dactylitis recorded by a rheumatologist. And lastly would be radiographic evidence of juxta-articular new bone formation in the hand or foot. So this criteria has a sensitivity of only 91%, but specificity of 99%. And then if you're asked, current psoriasis is assigned 2 points, and all other features are assigned 1 point. So pwedeng current psoriasis plus any of the 4 other features will already satisfy the Caspar criteria. All right, so we proceed to the next question. So for the next question, which of the following clinical features of your Plasmodium falciparum malaria is associated with a poor prognosis? So time's up. So a majority answered A, oliguria at 67%. Then next would be B, which is hypoglycemia at 19%. Then we have C at 10%, and then of course the least was a body temperature of less than 37. So let's see the correct answer for this number. So actually the correct answer is letter C, hyperventilation. So I'll explain that in a while. So, but first, let's look at this table. So know this table by heart. So what are the characteristics of the different Plasmodium species infecting humans? So we have 4 types of 4 major species that cause disease in 5 major species rather that cause human disease. So What is important in this table is to know the approximate duration of the erythrocytic cycle. So how many hours? So usually they ask this, which one is the quartan, which one is the tertian, and then you have the 24 hours. And then the preference for red blood cells is also important because there are certain like P. falciparum which infects younger cells. This is also similar to your P. knowlesi. Ito siya. And then it's also important to know the pigment and also the relapse. So there are those that causes relapse such as Plasmodium vivax and Plasmodium ovale. So next we'll show you the tables demonstrating what are the major manifestations of patients with severe falciparum malaria. So in the 5 species we've shown you earlier, most of the severe cases are due to your falciparum species. No? So it's important to know what are the major manifestations. So it includes the following. So please know this table and familiarize yourselves with the values. So hypoglycemia is actually here, and then renal failure is also here. So both of them were presented in the choices earlier. And then other features include hemoglobinuria, extreme weakness, hyperparasitemia, and jaundice. But why is the answer hyperventilation? So the question was read as what clinical feature? So you have marked agitation, hyperventilation, or respiratory distress. The body temperature should be less than 36.5 and not 37. So you have bleeding, deep coma, repeat convulsions, anuria, not oliguria, and shock. So many of you answered oliguria and also hypoglycemia. But hypoglycemia is actually a laboratory feature. It's not a clinical feature because you need to document capillary blood glucose level or your random blood sugar levels prior to be able to tell that it's hypoglycemia. That is the basis of that is your Whipple's triad. So please familiarize yourselves with what are the clinical and the laboratory features. So magkaiba yun ha. So now we proceed to the third question. So for the third question, which of the following clinical features best describes the chest pain of acute pericarditis? So time's up. So a majority of you answered letter D, radiates to the trapezius ridge, that's 60%. And then letter C is intensified by leaning forward, 24%. And then A, right sternal. And last, the least common answer was often present in uremia. So the correct answer for this question is letter D. So it's dog. So it radiates to the trapezius ridge. So it's not right sternal because most of the time it's actually left sternal. Since that is the location of your, the heart is more on the left side. So you would expect more left sternal. And then boy is, it's often absent in uremia. And C, it's intensified in the supine position and actually relieved in the leaning forward position, and this is correct. So it radiates to the trapezius ridge. So prior to that, let's look at certain classification of your pericarditis. So classification of pericarditis, this table is important. So you have acute and you have subacute and you have chronic. So you have to take note of the time frames. So acute is less than 6 weeks. Subacute is 6 weeks to 6 months, and then anything more than 6 months is chronic. And then under those durations, you have a different etiologies. So kunwari acute, it's usually fibrinous and effusive. Whereas for chronic, it could be adhesive and constrictive. No? So medyo it will give you a clue as to the etiology kasi constrictive, ibig sabihin, ano na siya, no? Nag-fibrose na yung pericardium mo. And then for etiology, you have infectious, you have non-infectious, then you also have related to autoimmunity. So these etiologies you have to familiarize. Now, what are the viruses, the bacteria, and also the fungal species that could cause pericarditis? And for your non-infectious causes, please do familiarize. So usually, tinatanong dyan is ito, metabolic, myxedema, cholesterol. And then for your autoimmunity, you also have to be familiar. But most of the time, they usually ask the drugs. So that includes procainamide, hydralazine, phenytoin, isoniazid, among others. So yun, medyo kailangan alam nyo siya. So ito din. So ito, trivia na lang, that's Molibre nanism, which is an autosomal recessive syndrome characterized by growth failure, muscle hypotonia, hepatomegaly, ocular changes, enlarged ventricles, mental retardation, ventricular hypertrophy, and a chronic constrictive pericarditis. So ito siya. So just to go into further detail, the pain of acute pericarditis is often severe. It's retrosternal, it's left precordial, and it's referred to the neck, arms, and left shoulder. So left-sided, as we said earlier. It's pleuritic and accompanied usually by pleural inflammation. So it could, it's sharp, aggravated by inspiration, coughing. It radiates to the trapezius ridge, or it even resembles myocardial infarction. So characteristically, pericardial pain may be intensified by lying supine and relieved by sitting up and leaning forward. So that's important. And this is often absent in slowly developing tuberculous, post-radiation, neoplastic, and uremic pericarditis. So it's important to know that it's absent in the 4 etiologies we outlined here. All right. So I think most of you got this question right. So now we proceed to the next question. So for the 4th question, the following causes of cardiomyopathy will present with preserved ejection fraction on echocardiographic studies except so time's up. So majority answered letter B, constrictive cause, and then this is followed by A, dilated at 31%, then C, hypertrophic 17%, none of the above 1%. So medyo varying pa yung answers natin dito, no? So actually for this number is, you have to read the question carefully. So the question is, which of the following causes presents with preserved ejection fraction except, so ang tinatanong dito, sino yung hindi preserve ang ejection fraction? So the correct answer for this is actually A, it's dilated, because severe causes of dilated cardiomyopathy will have EF of less than 30%. So the basis of this would be this table here, table 259-1, so the typical presentations of symptomatic cardiomyopathy. So the first line would show you ejection fraction. So a normal EF is 55%. Dilated will present with less than 30 if it's severe, whereas restrictive is usually more than 40 to 50%, and hypertrophic is usually more than 55%. So for this table, take note of the ejection fraction, the left ventricular diastolic dimension, also the wall thickness, and the other features. So pansinin nyo, iba-iba yung mga features, but you have to familiarize yourselves, no? Let's say for congestive symptoms, usually ito, pag dilated, left before right, but right is prominent in young adults. Pag restrictive, right ang nagpredominate, and then pag hypertrophic, left-sided siya, pero it develops late, no? So these are some of the features you have to familiarize yourselves with. So now let's proceed to the next question. So for the next question, the following tests are considered level 1 recommendations by the American Heart Association except for so time's up and a majority, so almost all of you answered letter D, cardiac catheterization, followed by C, your TSH, thyroid stimulating hormone, and then minority answered boy, ECG, and A, lipid profile. So, but the correct answer actually for this question is letter A, it's lipid profile. So, but first, before you answer the question, you have to know what is a level 1 recommendation. So in this slide, so you have the level of recommendation. So the lower the number, the higher the strength of evidence. So level 1 is usually from a randomized controlled trial or meta-analysis of RCTs with results. So I think this is important to know, not in the IM, but more in the PrevMed part of your exam. So of course, the lowest level of evidence are expert opinions, case reports, and personal observations. So now you know a level 1 recommendation. It means it's from RCTs or homogeneous meta-analysis. So you will now go to this table and see which is a level 1 recommendation. So ito medyo kailangan familiar kayo. So the superscript A, which corresponds to level 1 recommendations from the American College of Cardiology and American Heart Association, includes ECG. It includes your thyroid stimulating hormone and also your cardiac catheterization here. So ito. So pasok sila. So karamihan for this table, if you're going to study this table, karamihan ng mga tests dyan, they're actually level 1. So what you need to know are the not level 1. So ano ba yon? So that includes your lipid profile, your serum iron, transferrin, your urinalysis, creatinine kinase, troponin, and your eosinophils and your ESR, as well as your DNA sequencing. So ganun yung approach siya aaralin. So when you see a table, you see a figure, tapos may 2 distinguishing characteristics siya or 2 different categories, mas mabilis alalahanin yung mas konti. So it's not wise to memorize all the level 1 kasi malilito ka. So instead, you memorize the lesser in number. So that's the non-level 1 recommended tests. Ganun siya. All right, so now we proceed to the next question. So significant neuroglycopenic symptoms or decreased cognition in hypoglycemia occurs at what range of glucose in milligrams per deciliter? All right. So medyo malapit pa rin yung choices natin, no? So a majority answered boy, 50 to 55 milligrams per deciliter. at 42%, and this is followed by A, less than 50 milligram per deciliter at 39%, and then of course we have C, 65 to 70 milligram per deciliter, and dog 2%, no, answered dog 80 to 85. So of course, by physiology, you would already rule out letter D kasi you won't have hypoglycemia in this range of sugar in most patients, but you will get hypoglycemia in the three other values. So ngayon, iisipin na lang sino yung most likely pwede ka magka-hypoglycemia. Most likely it's A or B. But the question kasi is, at what range eh? So yun yung tanong. So to answer this question, the correct answer actually for this question is dog, letter B pala, boy. So it's 50 to 55 milligrams per deciliter. But remember, not all patients will develop hypoglycemia at 50 to 55. This is just from population means that a majority will develop this hypoglycemia at this level, because there are patients who already have symptoms at 65 to 70. O meron namang iba na less than 50 pa. So this is a very important table that you need to know by heart, not just in internal medicine, but also in your physiology and also in your future practice. So ito, makikita niyo tong table na to many times in your handouts and also in the many quizzes and sessions that will be given to you. So remember, the first response is insulin, and second response is glucagon. And then the third defense is epinephrine. So ang hindi critical, not critical, kailangan dito tandaan, is cortisol and growth hormone. So you will get symptoms at 50 to 55. So yun yung correct answer. So if you are already less than 50, then decreased cognition na siya. So mabilis lang tandaan tong table because glucagon, epinephrine, and cortisol will have the same glycemic threshold at 65 to 70 milligrams per deciliter. Tapos, ang insulin yung at 80 to 85. And then, once you know already yung symptoms, cognition is less than 50. So ito, know by heart. Yung physiologic effects, no need to dwell on this too much. But you need to know the numbers and the roles of each of the hormones. So next question. Which of the following drugs in diabetes is considered first line among those with a clinical atherosclerotic cardiovascular disease? So this is a pharmacology and internal med question. All right, so a majority answered letter C, sitagliptin. So it's followed by boy, pioglitazone at 80%, and then gliclazide A, 15%, and then a minority answered dog, semaglutide, no? So again, recall the different classes of medications, no, based on your pharmacology lecture and also our endo part in the internal medicine. So we discussed the drug classes extensively. So gliclazide, it's sulfonylurea. Then pioglitazone is a thiazolidinedione. Your sitagliptin is a DPP-4 inhibitor, and your semaglutide is a GLP-1 receptor agonist. So the correct answer for this question is actually letter D, semaglutide. So why? So tanong kasi is first line in a patient with clinical atherosclerotic vascular disease. So in the latest ADA 2022 and ADA 2023 guidelines, if you look at this figure, all patients, this is a guide for glucose lowering therapy in type 2 diabetes. So again, it's advised to have healthy lifestyle behaviors, and then your diabetes self-management, education, and support. And they included this new concept na familiar to all of us, the social determinants of health, because that will dictate the diabetes care, no, in most settings. So if you look at this algorithm clearly, in the past, we used to be glucocentric. Ibig sabihin, ang goal natin sa pag-treat ng DM is to lower the sugar. But recent evidence are now showing that certain diabetes drugs have actually cardiovascular benefit, renal benefit, and also heart failure benefit. So pag tinignan nito ang algorithm, hati na siya, no? It's divided into two parts. Glycemic control is on one side, and cardio-renal risk reduction is on the other side. So makikita ninyo dito sa figure, you have ASCVD, you have high risk for ASCVD, heart failure, and CKD. And if you go down the ASCVD algorithm, it will give you only two agents. It's either SGLT2 inhibitors, your sodium glucose transporter 2 inhibitors that's in the proximal tubule, or your GLP-1 receptor agonist. So heart failure, SGLT2, CKD is either SGLT2 or GLP-1 receptor agonist. So these are the newest drugs for type 2 diabetes which have shown cardiovascular and renal benefit. So yun na siya, no? We're already changing the landscape of type 2 diabetes management. Ngayon, yung mga sinagot natin na mostly sitagliptin, pioglitazone, and gliclazide will fall under glycemic and glycemic goal because they don't have cardiovascular benefit. So dito niya na makikita. So know this figure by heart, no? This is in the latest ADA 2023 guidelines, no, which was published this January. And then this is also another useful table I've taken from ADA. So this lists down all your DM drugs, which includes oral hypoglycemic agents and insulin and injectable therapies. So makikita niyo dito si SGLT2 inhibitors saka si GLP-1 receptor agonist, sila yung merong effect on MACE. Ano bang ibig sabihin ng MACE? MACE means major adverse cardiovascular events. Ibig sabihin may mortality benefits sila. So among the SGLT2 inhibitors, those with benefit include two agents, that's canagliflozin and empagliflozin. Then for your GLP-1 receptor agonist, you have dulaglutide, liraglutide, and semaglutide. So yung ibang GLP-1s such as your exenatide, lixisenatide, they are cardio-neutral. So majority of you answered sitagliptin. So that's a DPP-4 inhibitors. It's actually neutral, cardiovascular-wise. And then some answered thiazolidinedione, pioglitazone. It's actually potential benefit for pioglitazone, but it's just a potential benefit versus a definite benefit. Then may sumagot ng sulfonylurea, neutral din siya. So yun, no? So know these new medications also. Because they're not just used by us endocrinologists, they're also used by nephrologists and cardiologists already. All right, so we go to the next question. So in a person without any comorbidities, at what age does diabetes screening start based on the 21st edition of Harrison's? All right, so we have our answers in. So majority answered A, 39% na yon. Then B would answer 40, 29%, and then C answered 45, 24%, and then of course the least choice is 50, no, letter D. So what's the correct answer for this? Actually, dalawa lang pagpipilian nyo dyan. Kapag diabetes screening, it depends on which guideline was used. So of course, the most updated, you have to know the source for this question kasi this is a common question that's for contention. If they don't cite, they will not cite the source kasi mag-iiba yung sagot. So the most updated evidence in terms of screening would be ADA guidelines. But your exam might be lifted from Harrison's, which is also the source of the other questions. So kung ganun yung case, you have to follow Harrison's. And usually Harrison's is around 3 years late when it comes to CPGs. So pwedeng hindi siya updated. So the correct answer for this question is actually letter C, 45. It still uses ADA 2021 guideline. No? So this is a useful slide distinguishing screening in Harrison's and ADA 2022 and 2023. So let's look at Harrison's 21st edition. It's the screening for individuals without comorbidities will start at 45 and every 3 years. So you can screen earlier if the patient is overweight or has one additional risk factor. So papakita natin yung table showing the risk factor for risk factor to develop DM, and then there's a caveat in Harrison, so it says immunologic markers in type 1 DM. It's actually not routinely used outside of research or clinical trials. So even for us endocrinologists, we don't routinely request for anti-GAD, anti-IAA, except if we're really strong, if the evidence is really, really strong to suspect type 1 or LADA, for instance. Because yun nga, at this point, beneficial interventions have not been demonstrated for those with positive antibodies. But for ADA 2022 and ADA 2023, testing should begin at no later than age 35. No, if you don't have comorbidities, you start at 35. Then screening can be considered at any age. So iba na siya, no? Any age na siya if the patient is overweight or obese with one or more risk factors for DM. So the next slide shows you the risk factors. So ito na siya. It includes your family history, your race, ethnicity. So ito yung mga high-risk races na kailangan alamin. The cutoff for hypertension is 140/90. Low HDL, high triglyceride, your PCOS, acanthosis, your history of cardiovascular disease, physical inactivity, and also insulin resistance conditions, no? Severe obesity, acanthosis. Now, those patients who are already IFG or IGT, ibig sabihin, meron ka ng na-diagnose sila previously, you screen annually. And then, women with GDM should be screened every 3 years. No? And then, this is Harrison's kasi. So, initiate testing at 45 and repeat every 3 years. And they added, no, individuals with HIV should also be screened for type 2 diabetes, regardless of age and other risk factors. So this is from ADA. This is staging of type 1 diabetes. So diabetes is type 1 is staged according to the presence of symptoms and glycemic level. Kasi lahat naman sila may autoimmunity na. So, ang magdi-distinguish na lang, it's whether pag stage 1, it's normoglycemia, stage 2 is dysglycemia. Ibig sabihin ng dysglycemia, IFG, IGT, or A1C of 5.7 to 6.4%. Now, if the patient is already overtly hyperglycemic and symptomatic, then it's already, pasok na siya sa criteria for DM, that's stage D na. So, that's already full-blown type 1. So remember this also by heart, the criteria for the diagnosis of DM. So for fasting, know the cutoffs in milligram per deciliter and also millimoles per liter, and also the definition of fasting, no, which is at least 8 hours. And then alamin nyo rin yung cutoff for prandial. after a 75-gram OGTT and also on the HbA1c, which should be a method certified by the NGSP, no, or your National Glycosylation Standardization Program. And then, of course, RBS plus symptoms. So I find this table useful also for classification of diabetes. So we're all familiar already with type 1, the autoimmune type, type 2, which is predominantly insulin resistance and obesity. And you have specific forms. You have your MODY, you have your neonatal, and you have your GDM. So ito, useful lang to know. And ako, usually, they ask about drugs and certain endocrine conditions that could cause diabetes, as well as infections. No, let's say congenital rubella, cytomegalovirus, and neurococcus. All right, so we proceed to the 9th question. So in a patient who develops contrast-induced nephropathy, when does the peak rise in serum creatinine occur following exposure to your contrast media? All right, so all our answers are in, no? So a majority answered 24 to 48 hours. Letter B, no, 57%. So this is followed by letter C, 24% answering 3 to 5 days, and 19% answered letter A, which is 12 to 24 hours. So for this question, mabilis na matanggal yung dog, no? You won't get rise in creatinine this long. It's physiologically unsound. So hindi rin siya 12 to 24 hours. Ma-exclude nyo rin siya kasi it's too early naman. So dalawa na lang pagpipilian nyo, 24 to 48 or 3 to 5 days. So the correct answer is actually C, 3 to 5 days. So this is so remember, contrast-induced nephropathy is an acute type of kidney injury. It's not CKD, it's AKI. So it can be resolved with hydration, and once the contrast has been removed. So this is a useful table in Harrison's telling you the stage of AKI in terms of creatinine level and also your urine output. So, mapapansin nyo AKI stage 1, 2, 3. No? So, sometimes your residents would write in the chart the AKI stage. No? So, it's based actually on the level of serum creatinine and your urine output. So, just familiarize yourselves with the cutoff. So, madali naman siyang tandaan kasi 1 to 1.5 to 1.9, 2 to 2.9, and then anything greater than 3. And then yung sa urine output, mabilis rin siyang matandaan. Nag-iiba lang yung hours tsaka yung ml. Of course, pag may anuria, 3 na yon. So this is also a useful algorithm, no, for your exam. So for acute kidney injury, you divide it into 3. So that's pre-renal. It means before entering the kidney. Intrinsic means anything inside the kidney. It could be the glomerulus, it could be the tubules, the interstitium, and any vessel inside. And then post-renal means outside also the kidney, but it's already after filtering. So, ibig sabihin ng involved dyan, urinary bladder, urethra. So, ito siya. So, madali siyang tandaan because pre-renal is easy to determine. It's also the most common. So, mabilis na hypovolemia, decreased cardiac output, anything basically that decreases renal perfusion. So, these drugs, alamin nyo siya, NSAIDs, ACEs and ARBs, saka cyclosporine. For intrinsic, madali din siyang atandaan because you can subdivide it into 3. So, the glomerulus, the tubules, and the vessels. So, si glomerulus, mabilis. GN. Si vessels, mabilis. Vasculitis, malignant hypertension, and your thrombocytopenic purpura and your hemolytic uremic syndrome. Of course, post-renal, it's already easy. Bladder or urethra. Ang medyo anahin lang dito is the tubules interstitium because you have several causes, but usually they ask about nephrotoxins. So nephrotoxins can be exogenous and endogenous. So madali din tong tandaan because most of the drugs, most of the contrast materials are exogenous. And then endogenous, yung galing sa katawan mismo. So that includes hemolytic, anemia, hemolysis, rhabdomyolysis of the muscle, your myeloma, and your crystals. So mabilis siyang tandaan. So actually, if you're able to construct this on your own, you will already more or less know if tinanong to sa exam nyo, masasagot nyo na siya. Now, contrast-induced nephropathy is an acute type of kidney injury. So actually, it's negligible in patients with normal kidney function, but increases in the setting of CKD, particularly diabetic nephropathy. That's one of the reasons why we stop metformin before doing CT with contrast. So the most common clinical course for contrast nephropathy is a rise in serum creatinine beginning 24 to 48 hours after exposure. So rise pa lang siya. And then the peak will only occur at day 3 to 5. And you expect resolution in 1 week's time. No? Again, it's acute, so it should resolve once the underlying cause has been removed. So just some trivia, gadolinium, which is used in MRI, is associated with the development of your nephrogenic systemic fibrosis in patients with advanced kidney disease. So we also have to be cautious when we do MRI with contrast material kapag may CKD kasi it can cause your NSF in these subsets of patients. All right, so we proceed to the last question for this Quizmaster session. So among patients with pancreatitis or rather develop acute pancreatitis, when does the serum amylase level return to normal? All right, so all answers are in. So majority answered letter C, 3 to 7 days. This is followed by a B, which is 3 to 5 days. And then medyo similar numbers na ang A and D. So ito, first you have to distinguish, no? Kasi if you have acute pancreatitis, there's amylase and then you also have lipase. So kailangan alam ninyo siya parehas. So we'll go to the specifics in a bit, but to approach this question, I think maaalis mo na yung A because it is too short for your levels to return to normal, and then dog is too long to return to normal. So more or less your answer will lie between B and C. And then the correct answer is actually letter C, 3 to 7 days. So let's just first take a look. So causes of hyperamylasemia and hyperamylasuria can be due to pancreatic disease. So get to be familiar with the different causes and also non-pancreatic disorders. That includes your renal insufficiency, salivary gland problems, tumors, pwede din, burns, etc. Now, for acute pancreatitis and chronic pancreatitis, there are several tests that you need to know. So the most important of these is your serum lipase. So of course, inflammation will always lead to increased release of enzymes, whether it's lipase or it's amylase. But the important thing to know is that lipase is the enzyme measurement of choice for the diagnosis of acute pancreatitis because of its higher specificity. No, if the level is more than 3 times the upper limit of normal. Now, amylase is also specific, but if it's more than 3 times the upper limit, but it's most of the time it can be falsely elevated. So hindi natin ginagamit masyado ang urine, amylase, acidic fluid, hindi din masyado, pleural fluid, hindi din masyado, except if meron kang ascites and meron kang pleural effusion. For imaging, these are the different studies that could determine your pancreatic structure. So, ang pinaka-important dito, ang kailangan malaman ninyo is which of these tests are non-invasive. So, that includes ultrasound, CT scan, or MRI, but your ERCP and EUS are invasive. And then get to know the different specifications of each test. No? So, for example, ERCP can be used as a therapeutic procedure. Kasi pwede niyang tanggalin yung stones in the ducts. But the rest are just diagnostic modalities. No? And then you also have tests for exocrine pancreatic function. Remember, your pancreas has 2 roles. It has exocrine, ibig sabihin for digestive processes, enzymes for that. And you also have endocrine, no? So release of insulin, glucagon, your somatostatin, etc. So ito also get to know the different tests for your pancreatic function that includes secretin test, your endoscopic pancreatic function test, and also your secretin-stimulated MRCP. So ako dati, nung inaaral ko siya, inaalam ko yung what makes this test unique. So ano ba yung nagpapa-unique dun sa test? Yun yung naka-highlight. So para pag tinanong yung question, alam ko na kagad kung ano yung sasagutin doon. So kunwari, tinanong ka, require sedation. So alam mo na endoscopic pancreatic function test yun. Tapos pag tinanong ka na
Hello, Doc Harold. Wait lang guys ha. Ayan guys, kung nag-hang lang, nag-disconnect si Doc Harold. If you have any questions, please type in the Zoom chat box. Ano ba? Patapos na tayo mga bees. Okay. Last one number. I hope you learned a lot. And I'll try to contact Doc Harold kung ano nangyari ha. BRB.
All right, connected.
Alright,
But
Doc, congrats, Doc.
where was I?
Number 10
Ito.
na tayo.
So number 10, so I think we already answered the question. So we go back to the ano lang, just the few slides na ano. So again, for acute and chronic pancreatitis, so we have certain tests that you can request. So that includes your enzymes, your imaging, and also your enzymes, imaging, and exocrine pancreatic function. So what sa useful tip to remember these tables, medyo madami kasi siya, no? So remember the characteristics that makes the test unique, no? Kasi that will already more or less help you rule in and rule out. Pag tinanong kayo, ano dun yung certain tests, maaalis yun na yung mga alam niyo yung unique characteristics. You just have to list them down and parang kino-cross match yun na lang. Ito, wala itong ganito. Ito, may ganito to. So, ganyan. So, to answer the question, so enzymes in acute pancreatitis, so serum amylase and lipase values more than 3-fold the upper limit of normal are strongly supportive of the diagnosis. And there is no correlation between the severity and the degree of enzyme elevations or even the trends, no? So this is something you need to remember. So after 3 to 7 days, even with continuing evidence of pancreatitis, total serum amylase values tend to return to normal, whereas lipase remain elevated for up to 7 to 14 days. So mas mahaba yung ano ng lipase, no? Mas matagal mo siyang magagamit as a measure for acute pancreatitis. So with that, so this is actually already the last question. So I end the slideshow at this part.
Thank you very much, Dr. Chu, for that very, very high yield quiz master. I'm sure our students learned a lot po, Doc. Thank you. Doc, may questions lang from the chat box, if it's okay.
Actually,
i-read ko lang
siya mabasa.
Ito, Doc, piniem sa akin. Ang sabi, they're asking about question number 6, yung sa decreased cognition and the glucose level daw, Doc. Kasi, Doc, ang nasa handout daw po is less than 50 milligrams per deciliter. But the answer daw po is 50 to 55. Maybe they're asking for the clarification. Hindi daw po ba less than 50 yung answer?
So if you base that sa table, the 50 to 55 pertains to symptoms. But if you will look at decreased cognition per se, less than 50 yung nandun sa table. So ang maano ko dun is to read it carefully kasi pwede kang malito lang just with the words, no? So but decreased cognition is less than 50 talaga by definition.
Oh, okay. So for I hope it's clear na sa mga students natin, no? For decreasing cognition, it's less than 50. Thank you very much, Doc. So far, yun lang naman po yung question na ni-raise sa atin ng mga students. So thank you very much, Doc.
Alright.
Ang mga BBs, ang next quiz master nyo will be on February 8 and that will be surgery. So yan. Thank you and good night. Happy Aral. Thank you, Doc Chu, again.